A little additional organization with this new format. Just want to check in. Tony, we're good?
We're good. I'm going to ask everybody to unmute their phones for attendance roll call.
Okay. We'll call the meeting to order then for the afternoon of March 24th, 2020. Please rise for the Pledge of Allegiance.
I need to do attendance.
I'm sorry?
I have to do attendance roll call.
Okay, we'll do attendance first.
Jimenez. Here. Perales.
Here.
Dieppe. Davis. Esparza. Here. Arenas. Foley. Camus.
Here.
Carrasco. Jones.
Here.
Liccardo.
Here, for the record, I did see Councilmember Carrasco visually on the screen. I'm not sure if it could be heard verbally. Yeah, she is there.
There she is.
Yep, there she is.
Okay, so I'm
And-
marking present for Carrasco.
Okay, and Tony, do you have any?
Arenas and Foley.
Okay. I'm hearing a here from the TV.
And Foley.
Okay, so that was Councilmember Arenas who said here, I'm
And-
presuming, because her name was,
That was Pam Foley, she said.
that was Pam Foley. Okay,
Okay, everybody's present. Thank you guys for the patience.
okay. Let's rise for the Pledge of Allegiance. We're able? Thank you. For our invocation today, we'll try a variation of the old theme. Typically, we invite members of our community in, and I know under this, the current emergency, we're going to try to do things a little differently. Councilmember Perales will read a poem in lieu of an invocation.
Thank you very much, Mayor. We had a couple invocations scheduled for the duration of this month that it did not get completed, and so at the advice of Councilmember Davis, the idea rose on maybe giving a poem myself, and this poem actually was provided by her, and it's a poem by Laura Kelly Fanucci. And it's very telling for our time. Some of you may have seen it. When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, the taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hoped to be, and may we stay that way, better for each other because of the worst. Thank you.
Thank you, Councilmember. Those are words I hope we'll hear again soon. Okay, for orders of the day, I'd like to ask if anyone in the council has any changes to the printed agenda. I'd like to make one change, which is the 3.4, which was scheduled to be dropped. I just wanted to ask for us to hear that relating to the memorandum that I recently submitted. Vice Mayor Jones would like to pull item 2.19. I think that's from consent, is that right? That's okay, we'll move on to that in just a moment. Item 2.12, Hanson Bridget amendment. The city attorney will defer that to the April 21st council meeting. Item 2.2 is amended. Relating to the incorporation of current and future governor's executive orders regarding the Brown Act and City Open Government Sunshine Resolution. That would be added under orders of the day by a 2/3 vote, so we must approve this by at least 2/3 for that to be approved. Are there any other changes?
Mayor, I know it's, is it item 2.22 is the one that needs to be added to the Brown Act, the current future governor's executive order, Brown
That
Act
is-
reading?
Yeah, that needs to be added by 2/3 vote.
I'm okay with adding it. Is there any way I can ask a question on it?
Yeah,
do I
why
need
don't
to
we
pull it after I
consider
add
that
it?
under consent?
Right, so this item's going to be, you're just voting to put it on so you can discuss it. If it's not voted on, you can't discuss this aspect of
So
it.
then we can
Okay.
get to it under consent.
Okay, thank you.
Okay. Any other questions? No. Okay. Let's vote first on orders of the day.
I'll
Tony?
move the orders as described.
Oh, thank you.
Who was the second on that?
Me.
Thank you.
Thank you for
Okay.
the
I think I
motion.
beat you. I'll let you have this
We
one.
give it to Jones.
Mayor
Okay.
LaCarter.
Vice Mayor, all right. Got it.
Mayor
Okay,
LaCarter.
Yes.
Jennifer McGuire over here. We need, the administration also recommends to drop 2.16 and 4.1, just taking a pause here while we're evaluating our fiscal situation related to the COVID virus.
Okay, I'll ask the maker of the motion, Councilmember Perales, that's acceptable?
So dropping 2.16, the amendment to the master agreement with CPS HR Consulting, and then what was the other one?
The other one is the Police Department Sexual Assaults Work Plan.
4.1.
It's a 4.1, it's the use of the reserve right now while we're evaluating our fiscal situation.
Exciting.
Things got
feedback going on.
psychedelic there.
Got some feedback. Yes, I will incorporate those two into the motion for orders of the day.
Well, this is going to be fun, isn't it? Councilmember Esparza.
Thank you, Mayor. Yes, I have a question about 4.1. Do I ask it now, since we're dropping it under the orders of the day?
Yeah, if you'd like to speak on that issue about whether it's dropped, sure.
Yes, thank you. So, Jennifer, I guess this is a question for you in terms of when this item will be back.
So right now, the Budget Office is assessing our fiscal situation, which I was, discussed obviously last week, that it's expected to be severe. And so we will be bringing back a discussion of our fiscal situation planned for April 7th. And so hopefully, based on some principles of how we're moving forward, we can bring this back one way or the other within a month or so, I think would be a timeframe I'd like to look at. But we need to assess, how bad this fiscal situation, what are our options to help close some expected severe gaps, and making sure we understand all the trade-off questions. This is a very high-priority item for the administration and for the police department, especially given the nature of the subject matter and the orders that we're under right now, so we understand. So we want to make sure that the use of that money is in the highest, best use possible for our community at this juncture. And we need just a pause here to look at the use and see what we recommend to bring forward. So I'd say, we'd like probably a month, bring it back in April sometime to have that space to understand that in our fiscal situation as well.
Okay, so the end of April, this could come back so that we can move forward. I appreciate all your hard work on this. One of the concerns that we brought up last week was, given the shelter in place, what this means for child abuse, sexual abuse, and domestic violence. And so, unfortunately, those are realities moving forward. So thank you for staying on top of this, and I'll go ahead and support that, just knowing that it will be back in April.
And I just want to assure the council that the money is still in reserve for this purpose. There's no other action being taken to redirect it to anything or to change that manner of the use at this point.
Thank you.
And Councilmember Esparza, I'm happy to discuss with the city manager how we could have a discussion, particularly on that issue, sexual abuse, child abuse, and domestic violence in light of our new reality. Wow. And we come back in a future week prior to the time when we have that discussion about the whole plan, because I understand that is a particularly unique concern as we're experiencing the current crisis. Dave, you had another item.
Yeah, also, we were going to request deferral of item 5.1 as well. That's the airport master plan item.
Still on orders of the day, right?
Right.
Yeah, we're still,
Yes.
yeah,
Yeah.
yeah, I'm comfortable with that as well.
Okay. And that's all right with the seconder?
Yes.
All right, and for the members of the public who may be puzzled by all these changes, right now, we've got a very busy, underslept, overworked city staff right now is focused entirely on this crisis that we're confronting now, and they're doing an excellent job around a whole host of issues around continuing provision of services, as well as now taking on new responsibilities such as the distribution of food countywide. So everyone is very focused on that. We don't want to pull them into the council for these hearings until and unless the items are particularly urgent. And so these calendars will be a bit thin for a while until we're able to get the bandwidth we need to be able to engage more meaningfully. All right, on the motion, any other comments? All right, Tony, let's vote.
Okay, I'm going to ask everybody to unmute if they're remote. Jimenez,
Yes.
Peralez,
Yes.
Dieppe,
He's nodding his head, but we can't quite
okay,
hear him.
good, I can't see the screen when I'm looking down.
Yeah.
Davis. I'm going to move on to Esparza,
Yes.
Arenas, Foley, Camus,
Yes.
Crosco, Jones,
Yes.
Liccardo.
Yes. Do we want to try to run through the other?
Yes, I'm going to do that again.
Okay.
And if they can't audio, maybe they could text me and I can say it out loud.
All
I've
right.
got my phone in front of me.
So,
Davis, Arenas, Foley, Crosco.
to all those council members online, I see see Lund is clearly holding up a sign.
Lost audio is what he.
Audio is lost.
Okay, so okay.
Yep.
I'm
Councilmember
gonna
Dieppe
text
appears to be in
them.
captivity. He's got the, here you go, okay. He's now holding up another sign. Let's see if we can focus on that.
I can't see it.
Zoom people want to talk. They want to talk. Maybe
Yes,
on or-
Councilmember
oh,
Crosco would like to be heard
Probably on orders of the day.
on orders of the day. And I see her hand up.
Yes.
We're simply not able to hear her. So I'm going to ask Councilmember Crosco, could you please text something to
Okay,
Tony?
Henry's getting their audio, by the way.
They're getting their audio that we can't hear them.
Right.
Okay.
So guys, did you hear that? Henry's getting their audio.
Seems to be what Councilmember Crosco is saying.
I just created a group text for everybody who's doing remote, so they can text me.
Maybe a mic.
Okay, then I'm assuming Brown Act would require you to tell us what their text says. Is that right?
Yes.
Grab that mic.
Any information that you get during the hearing that's in response to a comment has to be made a public.
Before we go to the text, maybe we sort of break for an ability to get the
Yeah,
audio back up.
And I
think
will say, if
probably
they
easier.
text me, I will read it out loud.
Okay.
We're
Did
gonna
Councilmember
try putting the
Crosco,
microphone up to Henry's laptop.
Tony, did any of the council members? Tony, did any of the council members indicate they'd like to speak?
Magdalena did.
Wait, what? Sorry.
I'm sorry, I need your attention, Tony. We've just got
Sorry.
to focus on this. Did
Yep.
any of the council members indicate to you that they'd like to speak?
Not yet, but
Okay.
Kevin just told me that the council chambers can hear them, so I'm letting them know that, and I'm asking them to text me if they want to speak.
Councilmember Carrasco did, I believe. Had her hand raised.
No, but he can see her.
Sylvia also indicated she'd like to speak.
We're all in a group text.
Okay.
Glad we're getting this worked out before 2 weeks.
Yes. So you're not gonna do the microphone thing? Try, yeah.
Hello to everyone in the chamber.
Hello, Councilmember Crosco, we can hear you.
Arenas. Councilmember Arenas.
Okay, Councilmember Arenas would like to speak. Can we hear her?
Tony a text. I almost regret raising my hand, but I'm glad that I did because then that kind of helps us troubleshoot this audio issue that we're having. So I just wanted to reiterate what Councilmember Esparza brought up about making sure that sexual assault and domestic violence and any of those crimes that sometimes get augmented during crisis. And I can almost put money on seeing a rise of numbers, especially around child abuse, since parents or caregivers will have more time spent with them and uninterrupted time and no respite. And so I want to make sure that these issues continue to be in the forefront. I appreciate, Jennifer, your support with this, and I know that when it comes back, it'll be a good recommendation in terms of use of our resources. So thank you.
Thank you. All right. We are past orders of the day.
Shall we get their audio vote?
Did we actually get their audio vote, Tony?
We never did.
I can hear you.
And it's caps lock W.
What are we on? Are we on consent?
Oh, I misspoke.
Okay, and we're trying to relog.
Council members are gonna reevaluate the Zoom setup in the wing room. Oh,
Not your name.
I see,
but
I
the
see.
meeting
All
numbers.
right. Just give us 1 second.
Okay, thanks. Great, thank you. Okay, call you back in a sec.
Do we now have a vote?
Yeah, can they hear me to vote? Are you guys getting audio? The remote people? Davis?
Oh, do you want me to turn the volume?
Yeah,
on
you need to
here?
put the
Yeah.
mic back.
So we're voting on orders of the day. I still need to hear from Davis.
Could be fun.
Was that yes?
Should bust my hair.
They're able to hear you guys.
Okay.
Okay, so orders of the day vote.
They're able to hear you
Davis?
on the
Where's
vote.
Sylvia now?
Davis, are you voting yes?
Councilmember Davis?
Yes.
Thank you. Arenas?
Councilmember Arenas?
She's gone.
Foley?
She's back now.
Carrasco?
Councilmember
I'm
Carter?
here.
I'd
Okay,
ask all council members, when they're all asked to vote, if, after you've done so, could please text your response also to Tony, who will then read your vote from the text. So we'll be able to move along a little more
Yes.
quickly, given our technical challenges. Okay, I understand there's some folks we're not able to reach, but given the perfectory nature of this vote, I'm going to move on.
Yes.
We're on to the closed session report. And that should be a brief one.
There was no closed session today, so there's no report.
Thank you, Ed. All right, on the consent calendar. Now, Vice Mayor Jones would like to pull item 2.19 relating to local streets. Are there other items to pull from consent? Councilor Esparza?
Mayor, I'd like to pull 2.22.
2.22 for Councilor Esparza. Other items? All right, we'll entertain a motion on the remainder.
So moved.
Second.
Motion of the Vice Mayor.
Can you guys hear anything? Nope.
Okay, so we just heard they're not getting any audio remotely.
Okay.
Jones was the mover. Who was the seconder? Thank you.
So again,
Voting on consent.
let me, if I can, I'd just like to consult with the city attorney.
We have 6 present. We have a quorum.
Right.
It'd be easier to be full virtual. You wouldn't have this issue.
Yeah.
I'm gonna use the restroom.
So if I were to text them and make a record of
they're able to hear, and I can hear everything, they just
Okay.
can't hear my computer, I think.
So Tony, what I think I'd like to do, I understand they're having problems hearing us right now. We're
Yes.
hoping that will be restored soon.
We can hear you now.
Hear you now.
Okay, that's great news. Given all the challenges we're having, I'm going to create a text string right now that's going to include all of the council members who are relying on audio and video, as well as Tony. And to keep me honest, I'm happy to include anyone else. Would be the city attorney? No. City clerk is fine. Okay. So that way, anytime anyone would like to speak, if you are not sensing that I am recognizing you in a timely way, if you can please text so that we will immediately be notified. Okay, and just to be clear, that's council members Foley, Arenas, Carrasco, and Dieppe and Davis. Okay. Okay, so I'll keep watch on that, and Tony will watch as well.
Yes.
And we'll give this a shot. And if at any point people cannot even hear us, then also please notify us by text, and that way we'll all know. All right. We're on the consent calendar. There was a motion on the items that were remaining, that is, all the items except for 219 and 222. Given the challenges of voting, I'd like to first just take on 219, Vice Mayor.
Okay, I had a conversation with John Risto about item 219, and my question to him was about the outreach and efforts that they're making to bring small and local businesses into the contracting process. That's going to be especially important now that we're going to go into an economic downturn, and those small businesses are going to look to the city to be a lifeline in terms of having work to do and earning an income. And John actually walked me through a detailed presentation that he was going to give on March 17th, and I thought it would be valuable for the whole council to see the presentation. It's a short presentation, but I think there's a lot of value in everybody seeing it.
Okay. John?
There we go. Thank you. Good afternoon, John Russo, Director of Transportation. Yes, we do have a PowerPoint. I'm not sure if it's loaded or not. If it's not, I could certainly just walk through some of the questions that.
Why don't you
Vice
walk
Mayor
through
had.
if it doesn't load? Okay.
Or not in Granicus. 219.
The issues, yeah, the issues that the PowerPoint covers is really the whole preview of this summer's paving program. We had intended to do it March 17th when the first contract was coming through. Today we've got two items, 2.18 and 2.19. The PowerPoint still represents an overview of that, and I can just walk through it verbally very quickly and hit the points that at least the Vice Mayor was interested in. So as we had prepared and delivered the 2019, this current year's, or last year's pavement program, we heard a lot of very good direction and suggestions from council and mayor on how we might want to implement this year's work, which in regard to trying to get as many possibilities and opportunities for contractors, small contractors in the local area to be able to bid on these projects. So what we did do, oh, there it is right there. So what we did do is reformat our approach to this to actually provide some more opportunities. So last year, when we did the 2019 version, we did about 13 different contracts. This year, we've got quite a few more than that, and I'll go into that real quick. So just real quickly on the types of projects that we're working on, there's two really types of projects. Preparation projects where we're preparing the streets for surfacing activity, remove and replace, and then concrete ADA curb ramp improvements. Some of these today are fitting into that type of project preparation. And then we have final application projects, which is either the street sealing or street resurfacing. Those are yet to come. This is our pavement pipeline for this upcoming season. It just lays out the contracts we're going to be working on. And the ones, the highlighted one was last week. We've got two today on March 24th, 2.18 and 2.19. So what I'd like to do is just talk about what we're trying to do differently to provide some more opportunity for contractors. One, I did mention earlier that last year we had about 13 different contracts. If you add all these up, and we are going to split one of them up, we've got 22 different contracts we're going to be doing, so quite a few more. Coming up for today's are the concrete curb ADA ramps, and then the asphalt concrete remove and replace ceiling prep. What we also did, in addition to these that come to council, if you see under the first one under local and neighborhood streets, the minor concrete and ADA ramps, here's what we did with that. We took quite a bit of the work to do for preparation work and split those into much smaller contracts in the range of $300,000 to $500,000. We've already issued bids and awarded those contracts, and they're already underway. So we've got 8 contractors already in the field for about a month now. And I'll go to the next slide to show you what that looked like. So these smaller contracts have all been awarded to smaller contract firms, trying to achieve that balance of small to large. So these, again, are local area firms that have received contracts that are smaller in size that they can handle and are underway already, out in the field already. Coming up in the next couple of weeks will be the larger projects that we'll be doing, and those are the later dates in there. Assuming that we're gonna still continue to move forward with the program, we'll be coming to council with these other larger projects that are coming forward. So we'll be looking forward to some of the larger ones. Some of the questions that came up were, is it possible for smaller contractors to be bidding on these larger projects? And when we get into the resurfacing and sealing, some of the issues there with those projects are that it requires a lot larger and more expensive equipment. For instance, the paving machinery that we are using can cost upwards of $1 million. So it's just out of the range of some of the smaller contracts. So we think we've reached a balance between small contracts and the big ones where we get economy of scale, and we can handle it with the number of inspectors that we have. So the proposal out there right now gives us a really good balance of small contractors, medium-sized, and then the large ones that really need to take on the big bulk of the work. That completes my report. Thank you.
Thanks, John. Any questions on that item? Vice Mayor?
Yes.
No. Councilmember Esparza?
Yeah, thank you. I actually wanted to make some comments and then ask a question. So I actually wanted to add my voice in agreement with Vice Mayor Jones about the need that our local business community is going to have for these contracts moving forward. And we should not delay more than what we have to. Obviously, we're dealing with COVID, but, and my question is around COVID. This money is Measure B money, correct?
So this year is our first year of Measure T.
Oh,
So
T,
this
okay,
summer,
that's right.
we're gonna be
Last year
using
was Measure B.
$37 million in Measure T to do the resurfacing of a large amount of local roadways, so within the neighborhoods. It also includes Measure B from VTA and SB1 funds. So it's a combination of 3 or 4 different sources of funds.
And so just to, for the sake of transparency, could any of these funds conceivably used for another purpose?
By the vote on Measure T, no. that was pretty clear that it was directed. The other funds that were either state gas tax, it's a constitutional requirement that be used in specifically on roadways like this. And then Measure B, VTA could change the use of those, but it would still likely have to stay within a transportation function.
Okay. And then on the timing of the other contracts moving forward, there's so much that's uncertain right now, but how much of a lag do you see, just given what we know today, how much of a lag do you see in some of these other projects moving forward?
So we've opened quite a few of these already. We have 5 remaining bids to let and then open, but we have actually opened bids and they don't get awarded until they come to council. So it takes about a month between a bid opening to get to council, and then another month after award of council before a contractor would be issued a notice to proceed. So there's at least a 2-month before we open and issue a notice to proceed. So as these come through, there's months between when they would actually start. So I think there's, we're talking into June, July, and August before some of these contractors are actually out in the field.
Okay. Thank you. That's it.
I have Councilmember Jimenez and then Councilmember Rennes.
Yeah, thank you. One of the first questions I had is related to just things that are on consent. I know there seemed to have been a presentation, right? I think it was for item 219, right, Jim?
The presentation that you see up there today was actually intended for last week's item that was up there, and we just didn't have time to do it, so it was asked that we would do it today.
Oh, okay. I guess what I was just going to request, to the extent we need to modify anything, is just any item that's on consent, if it has a presentation, if the presentation can be attached to the item I legislate, because I don't think it's on there, and I think
It typically would, but because it was on consent there, it wasn't, so yes.
Yeah. So, good. So the other question I had is this, is that sort of touching a little bit on what Councilmember Esparza mentioned, but with regard to delay, not necessarily in implementing the contracts and such, but actual work. Do we expect any delays? And I know different parts of the workforce are impacted differently, and any delays in getting the folks necessary to conduct some of this work?
Well, so as I said, we have some work already out in the field. What we're doing is our inspectors are actually, they work from home, and then they go directly to their job site, and then they perform those duties with the correct social distancing and other required activities to maintain the right distance for all of the virus issues. So right now we do have work in the field. This would ramp up more of these projects. We are right now looking at whether or not when these bigger projects come through that would require additional effects in neighborhoods, such as moving of cars. So when these go into the neighborhoods, we've got, if you remember last year, we had to ask neighbors to remove cars off the street, and that means a lot of close activities with folks and people having to move and get out of their houses. So we're evaluating whether or not that can be done safely or not. We're also evaluating the safety of both our contractors, our own inspection staff, and just how the processing of these type of contracts fit in with the overall priority of the city with regard to essential services and the contracts that need to be put into that. So we're still assessing all of those things to see if many of these are going to move forward on the same timeline or not.
And then in your experience, do you think it's a practical request from us that are giving out these contracts to request social distancing of some of the contractors? I don't know if that's even possible.
Well, it did not get into the bidding documents of these early ones. It certainly could for the future. We still have future ones, but it's also an overriding state requirement and mandate, so, and a county as well. So it is something that we're practicing and contractors are as well.
Okay.
But it didn't get into any of the earlier contract specifications.
Okay, and then the very last question I have is, obviously, you just have to drive out into the streets, freeways, and see that a lot of folks are off the roads. And so what I'm curious about is, if some of this continues, do you expect that some of this work can be done quicker, given that there's less folks on the road and less impediments to clearing?
Yeah, one of the tough things is we have to maintain traffic in a normal time, and we work on that with both police department, secondary units, with trying to make sure that we are safe for both contractors, motorists, and our own employees. With less traffic, that certainly becomes easier. So that would certainly help us in terms of that. I think some of the areas that we're concerned about is when we get into the neighborhoods and have to move a lot of cars.
Yeah, because there will be more cars parked.
That's
theoretically,
correct,
in the neighborhoods.
right.
Okay, all right. Thank you for your work.
Yep.
I appreciate it.
Okay, Councilmember Arenas? See if we can hear you. Not able to hear audio at this time, so I'm going to ask if you can text if you're not able, if you've been trying to speak, Councilmember Arenas, and you're unmuted.
She's coming out of my computer again if you'd like me to put her through the microphone.
Hi, can you hear me?
Yes.
Okay, so I just wanted to thank Vice Mayor for bringing this forward, and I want to acknowledge Department of Transportation. John, you've been really receptive to a lot of our feedback, and I know that we heard this in T&E last month, and you talked about how having these minor projects would render additional business for small contractors, and this is something that you've heard from me over and over in T&E. It's wonderful that it's actually coming together, and it couldn't be at a more appropriate time. Is there any preference for San Jose businesses over outside of the city?
These are all bid for responsive and responsible bidders, and I don't believe that we actually have that I might have to ask a question. I'm not sure if we have a local preference on it or not.
So on low bids, we do not have
Not
a
a low bid.
local or small business preference.
Didn't think so.
Is it too late to add that to this minor projects?
I'll let Ed help me, but at this point, we're not able to introduce those pieces into the bidding environment. We are allowed to do outreach and other measures that we've been doing to ensure that the contracts are sized appropriately and take advantage of the abilities of local workers, but we're not able to specifically introduce a preference for local and small on low bid contracts.
Is that a legal matter, Dave, or is it just because maybe it hadn't been introduced before, or?
It's an issue, when you do local preference, what we did in our procurement is we gave them points, extra points, which we were allowed to do, so long as it's not a significant preference with regard to public works. I believe we have been looking at ways of doing that, but unless it's in the bid specs, we can't at this point just add it to the awards.
Actually, I think, Ed, there's a little more. I think that right now the charter doesn't allow us to, that all construction contracts must be above $100,000, must be competitively bid. I think we may have changed that up to 600,000, but anything over that needs to be competitively bid, and we're not allowed by charter to have a local or small business preference.
Well, I think we're going to look into that. You're correct. We're going to look and see if we could do that because it only applied to procurements, but we were going to look and see how we could try to do it. But at this point, we can't do it.
You know, this is something that I've also been asking, and like I said, I'm really grateful for your leadership, Vice Mayor. And I know that staff has been hearing me say this over and over again in T&E, and this is breaking down some of these projects so that, one, they can be more efficient, and so that we're not competing against our own selves and creating a higher cost for projects in the end. So I like that these are broken down a little bit more, but for me, I find like it defeats the purpose if we're not giving any preference for our small businesses or local San Jose businesses. And so I would appreciate if we can continue to look into how we can make that possible.
And if I could, council members, so yes, I think we're all committed to working through the issues and trying to bring something back to council that would work.
Now we have a couple more speakers. I just want to point out, this is a category of industry that is characterized as essential under the county and the governor's order. So these are businesses that are able to work, and I'm grateful for that. But I just want to make sure we're all sort of on the same page about the fact that these are folks who actually are getting work. Councilman Kemmis?
Well, I have to tell you, I'm very excited about the interest in helping small business. I wish it didn't take this kind of pandemic to spur interest in this. One of the concrete contractors that I've tried to talk into bidding on our projects for many years has suggested that our wage policy needs to be looked at, that it needs to be, you know, not let's put it this way. There's the state wage policy, there's the San Jose's wage policy, living wages, and we have 10,000 pages worth of wage policies that they have to delve through. I think one of the reasons why smaller companies don't apply or at least bid on our contracts, maybe not, is because some of our wage policies are not streamlined enough. And I think if we do, if our interest is truly to get more small companies interested in bidding our process, we have to take a look at what we can do to simplify our wage policies and other policies that make it much tougher and takes a lot longer than just getting, you know, a corporate bid out there. So that's just a word of advice, because I do talk to small contractors all the time that just don't want to wade through our bureaucratic processes, even to get some of these lucrative contracts.
Councilmember Esparza and then Councilmember Peral.
Thank you. So I had a question, a follow-up question on the policy coming back to us. So this is a question for you, John. What would those changes apply to those dates, or are those contracts after these dates?
So if you're referring to, could we change the specifications
For
to allow
these
local
specifically.
preference? So we've already, there are 5 contracts left that we have not yet put on the street for bid. Every
Okay.
one of the other ones have been opened already. They just haven't come to council.
So
there
those
there still
contracts are
5
not in this
remaining.
presentation?
Right, they're
It's-
on this
okay.
list, they're just not today.
Okay.
So those are bids that have been opened but not brought to council yet. So there are 5 remaining, the last 5 have not been bid yet.
Okay. That's it. Did somebody make a motion?
I was about to, but.
Okay. All right. So I'll make the motion to approve it with the guidance that the mayor had brought forward about bringing it back, and the vice mayor, I apologize, bringing that back to us with language about how to change it for the remaining bids.
Councilmember Perales?
Thank you. So I support this effort and conversation and trying to get more small businesses to take advantage of these smaller bids. My comment was a little different in regards to the timing. Councilmember Jimenez brought up potentially the opportunities because we're seeing less cars on the road. I was looking at the upcoming paving projects for the year. Now, a good number of them are in residential neighborhoods, which obviously we're going to see, I think, more cars parked on the street, as we were saying. But there's some, for instance, Center Road, that may actually see less cars, is what I'm thinking, but I could be wrong. McLaughlin, maybe some other roads that are actually less cars on them today, less cars parked off to the side because those cars are out in the neighborhoods. And then looking out on some, there are other roads like White Road, which was set for 2021. So my interest would be for DOT to take a look at the upcoming paving projects for this year and the next 2 years, and see if there is actually something where today or for the next coming months, there may actually be less cars, less impediments. Maybe we shift around that schedule and try to avoid some of the neighborhood streets, if indeed we're seeing that there's an issue there. So just for DOT to take a look at. Thanks.
And I appreciate John's willingness to do this. There are I'm sure many members of the DOT that are being pulled into the EOC right now. And so obviously all this policy work, I know my colleagues will be patient with the fact that we've got people working really hard right now, focusing on the very urgent issues of the moment. And so some of this policy work may take a bit longer to work out. Okay. Any final comments? Tony noted that the second was from Councilmember Arenas on this motion. So we're going to first vote on this motion before we move on to other. I'm just reading the text, so Tony can correct me if I'm wrong on it.
Yeah, we heard her over here.
Okay, got it. Okay, so on this motion, we're not yet considering all of consent, just this item. Tony?
Jimenez,
Yes.
Perales,
Yes.
Dieppe. He said yes. Davis,
Councilmember Davis?
Yes.
got it. That was yes if you didn't hear her. Esparza,
Yes.
Arenas,
Aye.
Foley.
Aye.
She said aye. Camus,
Yes.
Crosco,
Yes.
Vice Mayor Jones,
Aye.
Mayor Licardo.
Aye.
Thank you.
Okay, item 2.22, I believe, was pulled by Councilmember Esparza.
Yes. So I had a question about this item on both. So I had a couple of questions. One on the original memo, and so I think my question would be to the city clerk or to the city manager, but I'm going to look at you because I think you're the one, Tony. I know you're multitasking like crazy right now. So on the original memo on page 3, I had a question about the last, in the first paragraph, so that last section of the first paragraph, which says, without requiring a quorum of the members of the local body to participate from locations within the city's jurisdiction. So my question was, so for example, could the planning commission hold a meeting with 2 members? Is that, am I reading that correctly?
Okay, the Brown Act previously said you can only teleconference in. Members can only participate if there was a quorum present within the city limits. So we're just saying that if you have 2 members in San Jose and 2 members in Alameda, you can establish a quorum outside of the city limits, because that's what the executive order came out.
Okay. But,
There's a lot of restrictions
So a quorum is
before.
still required, right?
Yes, a quorum
Correct.
is still required. They just don't all have to be within the jurisdiction limits.
Cool. And then I had a question around the supplemental memo. The last sentence of the first paragraph that says, documents such as staff reports, ordinances, and resolutions would not need to be posted 72 hours in advance of the meeting. Is that specifically related to COVID, or all documents not be posted within 72 hours of a meeting?
I don't
Should I
think
look
we're.
at the
I-
city
Right,
manager, or
So
the-
what that was a proposal. Clearly, the council doesn't have to accept that. Under the Brown Act, even under the old Brown Act, before the executive order, the only thing that has to be posted is the item on the agenda, what the council is going to speak about. It doesn't require the posting of any documents prior to the actual meeting. The city council, back with the mayor, Chuck Reed, decided that they would supplement the Brown Act by creating the Sunshine Policy, which required the council to post documents 10 days before the actual council meeting. So the council itself decided to impose additional procedural requirements. The governor has now decided that they need to be more flexible in how they deal with public meetings. And so the proposal is to go back to the original intent of the Brown Act, which is basically you have to post an agenda item 72 hours before the actual meeting so that the public is aware of what the discussion is. The Brown Act itself does not require the posting of documents at any time. So this basically allows the city staff to rely on the way the Brown Act was originally, and not require the posting of documents with any period of time, so that they can finish up the documents necessary to get items on the agenda.
Yeah, I don't think Ralph Brown would have anticipated the internet or some of the posting that we do nowadays. So my question then is for the city manager. I'm not inclined to sort of approve sort of a blanket statement without any guardrails. I appreciate, you know, the enormous work and complications that this brings up, as we can see here today. But what I'm looking for is a little bit more of a guardrail on that statement. Can you be
I'm
more
gonna jump
specific?
in at this point. I think this is an important matter to consider, but we've got two heads of the Emergency Operations Center and a police chief that have been waiting and have to speak on this very first item and get back to work right away. And I think it's important that we hear from them, and then we're gonna come back and take up, and I think going forward, we're not gonna have consent items before 3.1, because I can't afford to have EOC heads and chief of police at a time like this sitting here while we're talking about pavement or anything else. And so what I'd like to do with everybody's patience is I'd like to jump to item 3.1 so we can get to that right away. And then from now on, what we're gonna do is we're gonna take up consent and all these items after we have a report from the Emergency Operations Center and key folks about the crisis we're currently facing. And I'm not in any way diminishing the importance of these items, but I think you all recognize the time constraints that many of our folks are under right now. So with everyone's permission, I'd like to jump ahead to 3.1, and then we'll come right back to Councilmember Esparza's question.
Okay, thank you, Mayor. So we've got quite a bit planned here under 3.1. Certainly appreciate the opportunity to provide this update. It was a week and a day ago that we went into level 5 and the county issued the health order that we are now working through implementation. So a week and a day ago. We've made significant shift in the organization in that time frame that we're going to share that information with you. I want to acknowledge the challenges we're having with technology here, and hopefully at our next meeting, which is in 2 weeks, we're able to overcome those challenges so that everyone can feel like we're conducting a productive meeting. Want to start off a little bit with the roadmap that we've been working on. And in essence, the four main priorities of our roadmap. The first is compliance with public health orders. And we'll have Eddie and others talk a little bit more about that in a minute. Our second is essential services and continuing all essential city operations. And I'll talk a little bit more about that in a minute. Third is support for at-risk populations, and we'll have Lee and Jim and Angel provide details on that. And then fourth is support for our people so they can act. Starting with the essential services, wanted just to acknowledge the fact that we have a lot of essential services functioning at this time, as you've heard me talk about, and I think you all are aware. That's more than just police and fire. And really our priorities are to the community that we are able to maintain at all times all public safety services, all essential city facilities and utility and infrastructure services, wastewater, garbage, energy procurement, and as we just talked about, our work on our roadways. I also want to acknowledge the fact that there's a lot of strategic support functions that are currently being maintained to support all of our work in terms of serving the community. And so certainly the operations in the EOC, our finance department with payroll and purchasing and accounts payable functions, investment monitoring, human resources, employee safety, workers' compensation and benefit services, information technology, network and server operations, cybersecurity, laptop and desktop support, and 311 services all is continuing with public works, fleet and facilities maintenance, and custodial services throughout the city. City Attorney's Office, contract, litigation, and other legal services, and City Clerk's Office with regard to the City Council meeting and contract execution support. When it comes to our employees and keeping our employees safe, We have put in place safety protocols to ensure that our workers are safe, both in terms of coming to work and in terms of performing their work. We have secured priority testing for not only our first responders, but our essential service workers, so that we have access to priority testing when employees are symptomatic. I also want to acknowledge that we do have employees that have tested positive, and so we have protocols in place to not only test, as I just mentioned, but to ensure that we're able to make sure that their coworkers and the public are safe. I know my microphone's having some problems, but
We're getting you a new one.
okay. Thank you. Thank you. So the safety of the public, safety of our employees is most important to us. I'm going to now have, I think I'm kicking it off to Kip. And as I mentioned, we'll get into support for our at-risk populations and also how we're seeing this play out for our city and our county. Kip?
Thank you. Kip Harkness, Deputy City Manager. I want to take a moment to walk through a little bit of what we're seeing coming with the COVID-19, what we know from our modeling, and what we think that means. And then we'll walk that through how we've organized our roadmap again, how we organize the entire structure of the Emergency Operations Center, and then do a deep dive into a couple of key topics, notably feeding and homeless support as both in priority topics and also an illustration of how we're organized. So the way they describe it in training is the role of the EOC director is to be the thinker anticipating the needs in the field. To fulfill that role, we are using data modeling to understand the spread and shape of the COVID-19 epidemic in Santa Clara County. Now, the data I'm about to present is a rough estimate. The county is working on a much more detailed and robust estimate, but given the urgency of the situation, we have decided to share this preliminary results with you and the public today in order to drive the action that is needed to save lives. So again, there'll be a range here. This is not a crystal ball predicting the future. And again, the actions we take can very much influence this data. But I want to walk through some preliminary modeling we've done based on the best publicly available models and the best publicly available data led by our futures group, led by our data analytics lead. So first of all, starting out with the confirmed cases and related hospital visits. Both of those, as you know, are rising on a daily basis. That rise does fit an exponential curve, but you can also see that our ability to test is falling even behind that curve. More importantly, our ability to test has been very constrained by the number of tests that we've had and our testing capacity, and we know that it represents only a small fraction of the actual cases that are out there. So our initial estimate, when we run the numbers, going back to the first cases that we know and what we know about them, and then run the curve from those first numbers based on some pretty conservative assumptions about transmission, are that we get a much, much higher number than the 300 some that you're seeing here. So you see three curves. The top curve is the worst case scenario with no mitigations or no changes, everybody going about their business. The middle curve is we've got some mitigations in place, but people aren't really following them. They're still mostly going about their business. And then the bottom curve is we've got those mitigations in place, and people are mostly following them. We've allowed a gradual lag in as these have been introduced. Bottom line, if you look down in the far right, at the bottom right, you can see a little tiny dots down there in red and black. That's actually the last graph that I just showed you. So all this information here is down in that little tiny bit at the bottom right. It's so small you can't even see it on the scale. So our testing doesn't even show up versus the actual case. Our estimate is then that there are between 9,000 and 19,000 actual cases in Santa Clara County right now today. So what's happening next? That's pretty important. There's, again, 3 different scenarios here. The large, big curve on top is nobody changes their behavior at all. The middle curve is they change their behavior a bit, but they're not really complying. And the smallest curve, in kind of the lightest color, you see is if we have strict compliance and enforcement of the public health orders. The black bars that you see are some estimates of our ICU capacity, our intensive care capacity. Again, the county will be doing much more detailed modeling on this, but this gives you a sense of what happens. What's important to this, remember last time we spoke that 80% of the cases are mild, about 20% of them are severe and critical, but it's really those critical cases that are going to require ICUs and ventilators, which are the most important. Without ICUs or ventilators, those critical cases, the death rate in those doubles. And so what we need to do is make sure that everybody who's critical has an ICU and a ventilator. And so we need to keep the number of cases below the number of ICUs and ventilators we have, and surge the amount of ICUs and ventilators we have to try to raise up to the number of cases. As you can see, the public health orders significantly flatten the curve in terms of the demand for ICU units needed. And if we surge, we might just be in the place where we're close enough to meet that demand. Third piece is the hardest slide to look at, and it's predicted deaths. Again, same 3 scenarios. The first one, we do nothing. Second one, we do something but not well complied with. And the last one, we follow those public health directives and orders very well and comply with them. You can see even in that best case scenario, we were looking at the order in the next 12 weeks of 2,000 potential deaths directly from COVID-19. So our preliminary data of the epidemic allows us to see patterns of what is to come, and that pattern is going to be long and hard. An examination of this pattern derives 3 key insights that I want to walk through. First key insight is there is widespread infection in the county now. The current number of 375 positive tests vastly undercounts the number of actual cases. As I said, our model suggests that could be 25 times higher or more than the number of reported cases. So that means we have a false sense of security in terms of thinking, oh, everybody who's tested are the only ones who are affected. No, there are a large number of us walking around who are infected. Second insight is we have one opportunity to bend the curve of this epidemic, and that opportunity is now. The good news is the public health measures put into place by both the state and the county, limiting travel, gatherings, businesses, closing of schools, requiring us to shelter in place, and socially distance, together, if complied with, will significantly bend the curve. This may be enough that if we dramatically surge our healthcare capacity, we can meet the needs of the most critical patients. This, again, is the best case, and even there, we are likely to see many, many hundreds or up to 2,000 deaths. Final insight from the patterns is the next 3 weeks are critical. Even with full compliance, we are looking at a high and to the right exponential growth of the epidemic, and then that will continue for the next 3 weeks, even if we are successful in compliance with all the public health orders. So within the next 3 weeks, we need to, as we hit the peak, assuming we do our job right, we will be seeing the maximum strain starting to hit the healthcare system and a maximum number of those who are sick and infected at their sickest. That means all of the capabilities and capacities that we are putting in place need to be able to be up and running at full scale within 6 months. So from these insights, we can begin to drive the actions that will do the most to bend the curve and protect our most at risk. What actions are those? Those actions at a high level are embodied in our roadmap in priority order. Our prime directive overall is to slow and reduce the spread of COVID-19 and support our most at-risk people. So that comes into 4 main categories that the city manager talked about. Number 1, and the most important thing that everybody can do, is compliance with the public health orders, shelter in place. This is this weird moment where the biggest thing you can do to help this is do nothing. Go home, stay on your couch, watch some Netflix. I know it's hard, especially for those of us who think action is the thing that we need to do. But in this particular epidemic, being may be more important than doing for most of us. Second piece is essential services, and the city manager talked about that. Third piece is support for at-risk, and the at-risk in this case is specifically the at-risk for this disease and the effects it will have. So we start with seniors and medically vulnerable. We include also homeless. We look for housing for those who are quarantined in isolation. And then the second wave of effects of economics on individuals, families, small businesses, and nonprofits. And we're actively ramping up teams and work in all of those areas. We'll talk about that more in a bit. In the last week, we essentially have entirely reorganized the management and service delivery system of the entire city in two important ways. One, we shifted from normal provisions of a wide range of services to just essential services and essential services provided through the lens of COVID-19, with attention to safety of the staff and community. Two, we shifted to new and enhanced services related to compliance with the orders and supporting the at-risk population, such as feeding and homeless sheltering, that are way beyond our normal operations, and in the case of feeding, way beyond our normal mandate as it expands to include the entire county. The structure of the Emergency Operations Center, which you'll hear Lee talk about more in a moment, is now up to 220 people who are part of it and 100% focused on implementing this roadmap. We must bend the curve now to avert the worst of this epidemic. The reorganization that we've done in the EOC has followed Jim Collins' advice in Good to Great and focused on putting together the right people in the right teams and giving them a high level of autonomy, getting the right people on the bus, in the right seats, and pointed in the right direction. As we formed those teams, we are asking them to do three things. Focus on the vital few actions. We are not able to do everything we would like. We have to pick a short and powerful list of those actions that will bend the curve most or protect those most at risk. Act fast. Within 3 weeks, we will be deep into dealing with the impacts, and we have only a narrow window to act. With the exponential growth of the epidemic, acting fast is more important than acting perfectly. And finally, scale the team for the long haul. Right now, we're in a sprint. Ultimately, this is a multi-sport endurance event. And so we're going to need the team that's going to be able to do all the different long-haul things and sustain this. This is not something we can stop after a week or 2 or 3 or 4 or 5 or maybe even 12. So Lee will talk more now in detail about how we've organized the EOC, and then we will take a look at some of the examples of our action approach in both feeding and homeless response. Lee?
Thank you, Kip. Can you go to next slide? Next slide. Thank you. So as Kip mentioned, a great deal of the organization and folks in the EOC, while we've been implementing over the past few weeks, a larger team of us have been focused on this roadmap and the importance of it. Usually some of these roadmap exercises for us lead to higher level objectives that the EOC would be pointed to, but it is very important for Kip, myself, as well as our operations chief, Angel, and Jim, that we operationalize these within the EOC and that we make very specific, measurable progress over the coming days. So what we've been able to do over the weekend is really take these roadmap items and work streams and put them in the operations center. So now we have teams as we move forward that are focused on these specific items versus one department focusing on just their part. So an example within the management section that Kip and I co-lead, the first one, the compliance branch, which is really compliance with the county's public health order. That's a team made up of folks from the city manager's office, PD, as well as EPIO. So these are interdepartmental teams that are focused solely on one mission. Same with under the personnel branch, the safety of our first responders and our workforce that are responding to this. That's a work stream within a roadmap that we've brought into the Emergency Operations Center to focus on. And Jim will focus on a few of those when we cover operations as well. But that's a different tactic for us to do, and one we believe, given our circumstances, that is necessary. The second thing is, as we had talked to you about in our study session, Emergency Operations Centers, we typically take a plan off the shelf once a disaster is hit, and then we can solely focus on responding to this disaster. As Kip has illustrated to you today, this disaster is still continuing. It's evolving and changing. So our ability and our need to plan while we implement is greater than it's ever been. So we've done a few different things, really 3 things, to augment our approach during this period. The first is we've added capacity to our planning section, which is really important, focused on our weekly goals, as well as we've stood up and you can see it in this slide, a future planning branch. And this is Something new that we're going to start is to really ensure that we keep those folks that are focused on those work streams and roadmap work streams on the actual problem. They can be focused on a few small actions, acting quickly, experimenting with them, and then quickly scaling them up so we can respond, while another set of people can focus on what's important in week 2, what's important in week 6. And similarly, with some of the larger problems that you'll see, or the larger work streams that are really complex and that we need to figure out immediately within the next 3 weeks, as Jim highlights, you'll see different planning or future groups embedded in some of those different work streams or roadmap exercises, so that we have folks dedicated to focusing and implementing on what's happening this week and the following week, while another set of people in the organization can do that long-term planning. With that, I'll hand it over to Jim to focus on operations and the changes made there.
Thank you very much, Lee. Good afternoon. I'm Jim Ortball. I'm the Operations Section Coordinator in the EOC. Angel Rios. So good afternoon. I'm Jim Ortball, and I'm the Operations Section Coordinator in the Emergency Operations Center. Angel Rios and I share that role. We shift on and off those roles. The Operations Section is the largest in the EOC. We coordinate the delivery of the essential services of the city. We've activated 10 branches within the Operations Section. We did that the week of March 9th. We activated an 11th branch yesterday. We operate remotely. We have conference calls twice a day with everybody from those branches representing all that you see on this chart. We have special issue follow-up, obviously, on conference calls with 10 different branches. Complex issues come up that need to be resolved among multiple branches. They take those offline, they work them, we bring back resolution, we move forward. We've had outstanding engagement and problem solving from all the branches involved. You can see on the essential services list that City Manager Sykes talked about, we have essential public safety with the police and law branch. Fire and medical is also a branch. They also have department operation and police command centers at their facilities that they're guiding their overall effort. I think the most important thing to really point out when you look at essential public safety and essential facilities, utilities, and infrastructure, our city is functioning. We are meeting the needs of our city in all of these areas. The staff and the folks in these branches are dedicated to doing that, and we are actually able to continue to deliver everything that we need to do to keep this city functioning. I think that's the most important point I'll bring out today on this chart. We also have a massive effort around logistics to keep all of these essential operations supplied with materials, equipment, particularly personal protective equipment, so that these employees can be safe in the performance of their duties. We've embedded the safety branch from the management section within operations as well, so that we look at all of our operations from the lens of how do we keep our people safe, and when they interact with the public, how do we keep them safe as well. So safety has been a critical component of what we've done, as well as logistics. We also have 4 kind of special branches, if you will. One is supporting the staff and the families of the essential workers. And one of the needs could be with schools closed is childcare. So we're standing up a childcare branch. We've identified needs for about 100 city employees that are doing essential work for childcare, and we're getting ready to stand that up later this week. Again, with safety protocols, the right approaches, so that's an important effort that we're leading as well. The 2 branches moving to the right side of the chart that you have there, kind of at-risk communities and populations branch. Angel is paying special attention to that area, focused on food and necessities that our community will need, particularly those that are most at risk, seniors and those with underlying medical conditions. He'll get into the detail of that in a moment. And then our homeless support branch as well, just maximizing efforts to focus on the needs of that community during this pandemic. And we'll also, Lee and I will get into more details on that branch as well. The last one, which we're standing up now, is a request from the county for quarantine and isolation housing for those people that are presumed or have confirmed COVID and need to be isolated. So that's something we're standing up now. We anticipate that coming forward, as well as potential step in or step down hospital type facilities. So we're working on facility work with the county on that. And with that, I'll turn it over to Angel to talk about food and necessities.
All right, thank you, Jim. So the city is taking a leadership role in standing up a countywide food distribution system. And to that end, we've convened 5 working teams that are working interdependently along these 5 work streams. The 5 are, the first one is identification of resident needs and prioritization. Second is food supply and chain sourcing. The third is food delivery and distribution with emphasis on countywide nonprofits. The fourth one is food delivery and distribution with an emphasis on private sector. And then fifthly, the volunteer and nonprofit coordination. And I'll give you some highlights in terms of some results and accomplishments in each of these areas. First and foremost, the business of identifying residents in need. Our main target population are seniors and the medically vulnerable. And over the last week, we've also added and included in that designation unhoused residents and those that are going to be using our child care resources as well. First order of business, we launched, as many of you already know, the Silicon Valley Strong.org website, and that's our primary point of entry for information both from the community and to the community. In addition to that, we've linked into the Second Harvest Food Bank and their Food Connection hotline, as well as the 211 platform as well. In addition to all that, all the different partners that we've convened, we're using their networks. We've been in contact with many of your offices as well, and so we're basically using every network we can, formally, informally, social media, et cetera. So the word is definitely getting out there. A couple of results that I think worth noting. Our first order of business was really to make sure that we maintain and preserve all the pre-existing congregate meal sites, both in the city as well as countywide in other cities. And we've been able to do that. We've been able to keep all but 3 open. And that's been a pretty significant step in the right direction, as these congregate meal sites were already tapping into some of the most vulnerable. Building on top of that, we really tapped into kind of really the core food distribution infrastructure that we have, which is Second Harvest Food Bank. On a daily basis, they provide 335,000 meals per day. And so one of our goals is to make sure that that system, that food source, stays open and strong. And to that end, we've been working in direct coordination with them. They immediately experienced a decline in volunteers for obvious reasons. We worked really quickly to fill that void. More recently, as recent as last night, worked out an arrangement in coordination with them and city, county, and state EOC to secure some assistance from the National Guard. And as of this morning, we have 80 personnel from National Guard assisting with food distribution in 2 of their main locations, the Kurtner site and the First Street site. Just in this last week, we provided 49,000 meals on top of what the Second Harvest Food Bank already provides. And so that's a significant step in the right direction. What we've also been doing is paying attention to emerging need. And to give you an example of how we're tracking that need, prior to COVID, the Food Connection hotline would receive on average about 180 phone calls a day. They are now receiving 800 phone calls a day. So we are definitely starting to see, number one, that need increase. And so we're setting up our infrastructure to meet that need accordingly. Another very significant move that we made was to really tap into our pre-existing school-based infrastructure. You know, the school system has a well-established food distribution network, and last week we, in partnership with many of the different school districts, we identified 30 locations. As of today, we're up to 88 school sites, providing food for people of all ages. Initially, this was a school-age focus. We've been able to modify the contracts to include all ages in that distribution, and we plan to continue to grow those number of sites as the need emerges. So that's really kind of on that first section. Around food supply and chain sourcing, we have a team really taking a close look at this, because obviously if food supply becomes compromised or limited, that obviously becomes a problem. So we have a team really working on this and monitoring this. We are tapping directly into the Second Harvest Food Bank GIS platform to help identify, track need, and to identify gaps. Just in the last week, we've identified some additional gaps, and we're able to stand up 15 new additional sites to meet emergent needs and gaps that we've seen. We've also been having conversations with Google and some of their analytics to kind of help us use some of their software to kind of track a need as well, and we could talk more about that a little bit later. Some of the key partners that we're working with: Second Harvest Food Bank, as I mentioned, the Health Trust, County Office, the Aging Services Department with the county, Silicon Valley Council of Nonprofits, SourceWise, Vegelution, Joint Venture Silicon Valley, First Five, Catholic Charities, and so many, many more. This third area around food delivery and distribution with an emphasis on nonprofits. We've convened an ad hoc nonprofit leadership council made up of high-level leaders from all those different organizations that I just mentioned and several others, all with the aim of just making sure we're facilitating good communication and coordination. As you know, we don't have a lot of time to wait. We got to act, and so oftentimes we're making decisions on the fly. So good communication and coordination is important, and I think that communication gets better every day. But as Kit mentioned earlier, the focus is on acting quickly, and so we're asking forgiveness later. Right now, we're just trying to address the need that is out there. But really good a session this morning, and a better understanding of how we're going to collectively coordinate and implement this strategy. This fourth line, this fourth stream really deals with food delivery and distribution using private sector partners. And this is really important because right now, we believe we have a really good handle on meeting the emergent need, but we're also planning for worst-case situation, especially if the need continues to grow at a pace of 15 to 20% per week. We know that the systems that we have in place right now are going to have to grow accordingly, right? So we are working with various private sector companies looking at scaling up food delivery to the tune of 100,000 meals a day and more if necessary. In order to do this, we've also identified needing to access food kitchens such as SAP, the county cafeteria, Google's cafeteria, basically anybody who has a commercial size cafeteria, we're identifying them and making contact with them, planning in advance, should we need to get to that level of food distribution. Some other private sector partners to date, Deloitte, ServiceNow, Five9, also some other nonprofit partners that have really stepped up in a big way, Hunger at Home, My Green Meals, and then there's other groups such as Team San Jose. So a lot of different people that we're tapping, a lot of people that are stepping up, willing to help. Lastly, and equally important, is our volunteer and nonprofit coordination workforce. Through the SiliconValley.org website alone, to date, we've already received 1,413 volunteers, just over a span of about a week's time. We've already deployed over 1,000 of those volunteers to different nonprofits such as Second Harvest Food Bank, Sacred Heart, Martha's Kitchen, Loaves and Fishes, and we're going to continue to recruit and deploy volunteers. On a parallel track, we're also making sure that they are safe, and so we're also we've been working with our HR staff to make sure that we're following proper safety protocols to make sure that we're not putting any of our volunteers in harm's way. In addition to that, we've also identified over 250 city staff people that we have been redeploying to also assist in various facets of this food distribution strategy, and similarly making sure that we're following the proper safety procedures to keep them safe as well. So a pretty significant startup just in this last week. We're going to continue to grow this system. It's a moving process, but I think we're in a pretty solid position right now, but more work to come.
Thanks, Andrew.
Thank you. The last work stream we wanted to talk to you about was homelessness. And since the last update that we gave to you, we've been focused on adding shelter capacity, expanding access to hygiene supplies across our unsheltered community, as well as sheltering the most vulnerable individuals. Our goal is to stand up thousands of temporary shelter beds as quickly as possible, as that is the number public health experts in the county believe may be needed to contain the spread of COVID among our unsheltered community. The joint city-county team is committed to adding as much shelter capacity as needed in the coming weeks, master leasing as many motels as needed, assessing the health of at-risk and symptomatic individuals as quickly as possible, as well as creating places for individuals who need to isolate or quarantine. Our team, or this team specifically in the EOC, includes many EOC sections, as well as various branches, departments throughout the organization, as well as the County of Santa Clara, Valley Homeless Healthcare Program, Destination Home, County Public Health, as well as a number of nonprofits. To go into the actions taken over the last week and a half, I'll have Jim Ortball walk through those.
Okay, thank you, Lee. So the actions that the homeless branch in operations is driving and coordinating with the county, they're moving at-risk individuals into vacant units at the Mayberry Bridge Housing Community and the Plaza Hotel. City staff is preparing Parkside Hall and the South Hall as temporary shelter locations. The county is preparing Gateway Pavilion at the fairgrounds as a temporary shelter location. The city's received 105 trailers from the state. The trailers are in position at Happy Hollow Park and Zoo in the east parking lot. But given their condition, we've initiated an inspection and refurbishing process. Significant utility setup is already underway, and initial availability is targeted for the week of March 30th. Their intended use is for isolation of presumed or confirmed people with COVID cases. The city's preparing to keep our overnight warming locations at Bascom and Roosevelt open 24/7. We're keeping our safe parking sites at Roosevelt and Southside open 24/7. On the hygiene and sanitation front, significant communications and outreach has occurred on safe practices and distancing, and dozens of portable hand washing stations and toilets have been deployed at large homeless encampments. The county is master leasing where possible to maximize sheltering capacity, and they have 3 motels under lease already. The county is partnering with the state of California to significantly increase the number of hotel-motel rooms available for emergency purposes, and the county is keeping their seasonal shelters open indefinitely. Year-round shelters are extending hours of operation, and the Valley Homeless Healthcare Program is conducting health and risk assessments of individuals and making determinations about who should be isolated and quarantined with medical professionals. Home First Homeless Helpline is continuing to handle calls from homeless individuals that are in need of assistance. Over the past week, this branch has made significant progress in both capacity and our ability to isolate individuals for their protection and the larger community's protection. We're doing that where we can. And with the actions to date, we have added or will add about 800 temporary shelter beds. Our goal, though, is to move significantly past that number to meet the numbers and need that Lee identified at the beginning of his presentation. And I'll turn it back to Lee to think a little bit more long-term.
Sure, thank you, Jim. And obviously that amount of work in a short amount of time takes a lot of hardworking people in the organization. And for us to do that planning function, as we talked about, within the homelessness branch, we have stood up a long-term planning or policy group to think through what do we need to start doing in weeks 3, 4, 5, and 6. And so that includes any policy that we need at the city as well as state and federal, any land use or logistical access around various sites, as well as connecting into the management section future group to better understand what we'll be looking at. And this group will be able to better identify the opportunities where the private sector can step up and help, as well as sort through the possibility of volunteers and helping us with this as we figure out the safety protocols for our volunteers. The focus over the coming days for this group is really on expanding the shelter capacity and other temporary housing solutions, which we may take advantage of for more permanent solutions as the city moves past this. With that, we're going to move to compliance with the public health order, and you'll hear from Kip and the chief.
So compliance is number one on this roadmap for a very good reason. It is our number one tool we have to bend the curve of this epidemic and make sure that we can save lives. And a prominent partner in that, of course, is our police and the enforcement wing, and I'll have Eddie talk about that in just a moment, but I want to frame up the other two pieces of how we're thinking about and implementing compliance, which are education and engagement. And we'll be using both our public information officer as well as our liaison branch to activate both of these. The education is critical. The good news is our best chance at compliance is actually voluntary compliance with appropriate enforcement. All available research from both health and law enforcement organizations tells us that this is achievable if we prioritize education, trust, and engagement of the public. About 9 out of 10 Americans say they would willingly comply with the shelter-in-place order if provided with appropriate education about the need for the order. So the city's publicly visible elected officials, you all, can provide critical assistance by educating the public on the need for the order and how, as a community, we are expressing solidarity with the most vulnerable among our community, the most at risk, by complying. Because as somebody was talking about, often we talk about our children as being at risk. In this case, sometimes the children are the risk, because what we're doing is protecting our elders, protecting those most at risk. And so staying at home, staying where you are and socially isolating is your way to protect others. And so we're going to be doing an education with the public on why and how and to most safely comply with the public order. We're going to be engaging both with the public and nonprofits, understanding their questions, reporting on noncompliance, and funneling that information to our police, as well as understanding barriers or issues that they may have to complying, and shifting our services so that those who want to comply can comply. That's where the food distribution and necessities distribution becomes very important. So with that, I'll turn it over to Chief Garcia to walk us through his approach with his team to the compliance with the public health order.
So with our approach, when the order came out, we unofficially started deploying some overtime cars on swing shift on Tuesday, March 19th, after the order was issued that had gone into effect on midnight. We started officially deploying the health order compliance cars on day shift Wednesday, March 19th. We deploy 4 2-officer cars on day shift and 4 2-officer cars on swing shift. Day shift runs from 10 to 3, and swings runs from 4:30 to 10:30. The cars work in each police division. Again, as I've mentioned before, the main purpose of the cars is to proactively seek non-essential businesses who remain open in violation of the health order. Officers who respond to complaints, calls through our dispatch center have been vetting using the health order criteria. Officers may contact the businesses, identify those responsible, give them a copy of the health order, and explain its purpose. At this point, it had been more educational in nature, and we had voluntary compliance. We have not run into any non-compliance, but should it happen, we would have a district supervisor and an appropriate resolution would be made. We are currently tracking contacted businesses and checking for continued compliance. Our current plan is to move from an educational stance to an enforcement stance on any business that has been contacted, warned, and then reopened. We are looking at this week to begin that enforcement. We have several remedies to include criminal citation, business license sanctions, and health code violations. We have been in contact with various city and county departments to explore some other options. Go over some statistics real quick. Since we started the cars on day shift of the 18th, I wanted to give, we've contacted 210 locations in that time frame. Of those, they include 25 smoke shops, 22 hair salons, 22 restaurants, 7 barber shops, 7 gyms, 4 flower shops, 4 clothing stores, 3 churches, 2 repair shops, 2 sporting goods stores, 1 video game store, 1 billiards hall, 1 gun store, 1 recycling center, 1 furniture store, a flea market, a car wash, a music store, 1 computer store, 1 window tint shop, and 1 mattress bed store, 1 party store, and a large group meeting. No citations have been written as of now, and quite frankly, that is what our hope is. The procedure and reporting requirements for citing locations was actually developed yesterday with the input of the district attorney's office. This is being communicated to all future compliance cars and will be sent out all to patrol today. Today, we're sending our compliance cars to specific locations where violations were observed on 318 and 319. Tomorrow, we'll send out compliance cars to recheck those observed violations on 320 and 321. This will be continued until all locations contacted during the education phase are recontacted. You know, in addition to that, and I'll tell you what, your men and women that have been working have been amazing, and they've risen to this challenge with just additional work on their plate, and they just, I couldn't be more proud of these individuals. In addition to all that, we're working closely with the DA's office in the event that we do issue a citation with regards to what information they will need for successful prosecution. Also, the DA has a public website that takes complaints. A team of DAs then ultimately vets those complaints, and they call the individual businesses. If they continue to operate, then they will contact us. They'll send the list over to us, and we'll compile them, and then we send that list out to our compliance cars for follow-up. You know, we may need to increase our compliance cars because of the volume of calls that we are currently undertaking. We do have county counsel at the EOC, which is an amazing tool for us to offer us real-time and essential real-time information on when we're contacting businesses and deeming them if they're essential or non-essential, which is obviously the big hurdle that we come across when we're out there. And this is new for law enforcement as well. You know, as it pertains to persons being out of their homes, I think this is important as well, because I think often we get the question with regards to what we're doing to businesses, and then we get the question of what we're doing for people that are out of their homes. You know, our order, you know, ultimately last Monday actually put out an order that our officers were not to stop or detain people solely because of the shelter-in-place order. You know, we came to the realization and working with the city attorney's office is that there were numerous exceptions to the stay-at-home order, and just by mere fact that someone's out of their home, we can't reasonably assume that they're violating the order. And as it pertains to groups, we're going to remain educational in nature. You know, I've given this example many times, and I'll say that I have a lot of faith in our community right now that I'll draw it akin to the red zone area. You know, if you have a red zone, we hope that every law-abiding resident will not park in a red zone. The ones that do, if a police officer comes by and they're in the car and the police officer says to move, most will move. There will be a small percentage of individuals that will look at the officer and say, nah, I'm gonna stick around. Well, then the officer's gonna have to do something else. And I really wanna look at it in that way. You know, as you know, we wanna continue to remain educational as officers. We get calls for service. We do get calls from people saying that there's groups of people playing. You know, we've gotten calls of people playing basketball at the park or what have you. We'll respond to that. We'll educate and tell people that they have to go. I'll tell you one dynamic that's, you know, as we continue to get calls from our community, is one dynamic that we're seeing, and maybe some of you have seen it as well. And I know I was coming from my mom's house over the weekend to give her some things, and on my way back, driving through and seeing some parks. I mean, some parks that we're seeing throughout the city look like it was a midsummer day with people going out to parks. I understand the messaging that we've sent with regards to exercise is important. But ultimately, if we truly want to help our officers try to help enforce this, we're going to need some help in some of these areas, because honestly, you know, I've gone through several parks, and really not just in the city, but in other cities as well, where it does look like a summer day where, you know, like out at those parks. And so that's an area that I think that's the next step that I think that we need to address at some point. But in conclusion, you know, as I've been saying before, we're going to get out of this at one point, and when we do, I think as a police department, we have to be mindful and thoughtful as to how we enforce these orders. I know I've been on calls with the Major City Chiefs Association, and we've discussed the fact that, you know, at the end of this, law enforcement agencies, we're gonna have a lot of work to do if we don't do this the right way in rebuilding our community trust. So those are some of the mechanisms that we're using for enforcement, and that's pretty much the end of my presentation.
I believe that's the end of our presentation. Turn it back to you, Mr. City Manager.
No, I'm done.
Great. Thanks, everybody, for all the information. We appreciate, most importantly, all the hard work that you're putting in, and everybody on your team, our teams, are putting in just every day and every night. I know that there's an enormous amount of work being done at all hours, and I just wanted to say a big thank you on behalf of all of our residents. I have Councilmember Arenas first. Are you able to hear me, Councilmember?
Yes, I can hear you. Can you hear me?
Yes.
Wonderful. So I wanted to get more detailed information about the child care piece. I know that our essential workers are the priority, but I was wondering, are they city workers that we're prioritizing, or are we expanding this and just in general essential service workers?
Councilmember, this is Angel Rios. Yeah, initially, we're focusing on city employees that are providing essential services, police, fire, and any other city employee that is providing an essential service. We're starting kind of with that definition. And we've identified two specific target areas. That's children 0 to 5 and then children 6 to 12. And so we'll be addressing their needs separately, two different strategies.
Okay, and so I think I asked this last week in terms of, is that what Jill Bourne is leading? Then internally, it's for our city employees.
That is correct. Jill Bourne and John Cicerelli are partnering up. Jill is leading that effort to do exactly that, yes.
And are you, because I think the county is doing something similar county-wide though, and I don't know if it's only for employees, but I think for all essential workers. I saw that, and I think Councilmember Esparza, you brought up that last week that San Francisco was opening up their community centers as child care centers. I'm just concerned that there's not enough child care slots available for our essential workers across the city, and I know that it's an immense need there. But if we don't provide some options for families, I can see how there's going to be inadequate care or more propensity to leave children with caregivers that are not appropriate. And I don't know if your next phase of the plan is to open this up to other essential workers.
Yeah, no, that's a good point. We are monitoring that very closely. What the county is doing, the county has actually entered into a contract with service provider to provide childcare for county employees. It is county employee specific. With us here at the city, what we've done is we've reached out to every single department providing essential services and have identified what the need is. So the employees are telling us what the need is, and then we're scaling up according to that need. To date, what the information that we received as of last night is there's 101 employees, actually 101 children that need either early care or school-age care. And so we are ramping up to meet that need, but what we're also doing on a parallel track is also identifying other locations so that as that need emerges or rises or grows, rather, we'll be able to meet that need as well. It's definitely a top priority for us.
Okay, great. You know, I did come across emergency child care for all, and this was from Hearts and Hands, and it's a Christian child care and preschool in Campbell. But it said, you know, at the request of Department of Social Services, we are now offering temporary emergency child care to all essential workers. And they didn't at any point in their advertisement say that it was only for. Of course, you know, they're prioritizing firefighters and officers, but it didn't exempt anyone.
Yeah, I'm not aware of that resource, but if you could send me any of that information, or actually we'll have our team look that up, and at this point, you know, what we're also doing is identifying any additional most childcare options right now are closed down. One of the things that we've been doing is working with the County Office of Education and specifically with Head Start, who have actually graciously offered to stand up some of their Head Start facilities targeting kids 0 to 5. And so I tell you, the County Office of Education and the various school districts that we're working with have been great partners in this. But we're going to continue to kind of scale this as the need grows.
And, I've expressed this in an earlier comment, Angel, and I know that you have this in mind as you work towards expanding this childcare. This is a very critical need, and I think it should be a priority for us to continue to either advocate through county services or expand our own service. Because our children, especially for those essential workers that continue to work, and might feel very stressed and frustrated that they still have to balance a whole other life outside of just work and also expose themselves to the risk of interacting with other people. When they come home, there's that increase of child abuse for our children in our communities. So this kind of respite childcare is, for me, essential for those workers. Can you hear me?
Yes, we can hear you faintly.
Hello?
Councilmember. Yeah, we can hear you. If you could proceed.
Sorry, Mayor. Can you hear me?
It's starting to go wonky though.
Hello?
Go ahead.
Now that the audio portion of this or the video portion of this is concluded, I wonder, Tony, would this be a good time where we could proceed and the telephonic system could be set up instead?
I'll let them know. We'll need up to 10-minute recess.
Do we have to have a recess, or could we proceed?
I was told we'll need a brief recess. He said 5 to 10 minutes, but he can probably come in right now and start setting it up while you guys talk.
Could we ask him to start setting it up?
Yep.
I don't want to take a recess yet, because I really want folks to be able to get back to work who are eager to do that.
Okay.
And then while stuff is getting fixed, hopefully. Councilmember Arenas, can you still hear us?
I can still hear you. Can you hear me?
Yeah, if you want to try your question again.
Yes. So I appreciate all the work of staff in making sure that we have food and shelter and, of course, childcare. I wanted to ask about the 30 locations, I think, Amy, that you mentioned.
If you could just use a mic, perhaps Jennifer's mic, right behind you, Henry? Right behind you. There you go. Thank you.
I looked up on the Silicon Valley Strong website to see if the 30 locations were on there, but they're not. Where can somebody find all of those locations? Oh, I see. I just now found them. So on some of those, here's where I was going to talk about. So on some of those, that information, I know that you said that we've expanded the criteria. It's not only food for children. It's for all the family, but not all of the schools are expressing that correctly. So say for Evergreen Elementary School District, they're saying that the child doesn't need to be present, but that's also assuming that they have a child. So it's leaving people out. Or, people can say, well, I have a child, but they really don't, and just go and grab food. But I think if it's more explicit, that would be great. In Mount Pleasant Elementary, it still says that child has to be present. And then under Alum Rock School District, it doesn't state anything. So I'm wondering if we can just really adhere to some common language, and that way it's transparent and clear for our families where to look for food.
Yeah, Councilmember, I think that's the ultimate goal. Where we're starting from is starting from the point of just keeping all school-age sites open, and then what we're doing is we're working literally school district by district to augment their existing contract and the language in their contract and their food vendor to be more inclusive of other ages over and above school age. And so I think what's going to happen is that these are going to be coming online in kind of a staggered format, and we're starting with the larger school districts that have the greatest or the highest number of sites, and then working our way back. And the goal would be to get them all online in the same way. I'm not so sure that we're going to be able to accomplish that 100%, but what we will do is make sure that we communicate, what sites target what ages. At the end of the day, our goal is to make food available for all ages, irrespective of age.
I appreciate that. Thank you so much. Those are I believe those are all of my questions. Thank you.
Thank you. Councilmember Davis?
Thank you. I have one question for Kip on slide 6. When you're looking at the high suppression versus the medium and the low, when you're saying that, do you mean that the high suppression, the compliance is not just social distancing, but is a stay-home order through April 7th, and then we get these numbers, or a stay-home order through the time of the graph?
Thank you, Councilmember. Kip Harkness here. Let me just grab my assumptions piece so that I'm speaking directly from the modeling. So what we're assuming is the introduction of the order on the day that the order was introduced, and we are assuming kind of gradually ramping into compliance and continuation of compliance. The top line assumes nothing at all. Everybody continues to go about their business, and there's even no self-mitigating. So that top line is very unlikely to happen in reality, because even if we had no order, people would change their behaviors. The middle line is sort of this middle level of compliance, which doesn't include all of the things that are in place, and includes a lower level, includes everything that's in place, but a very low level of compliance. And then the last bottom line assumes about a 70% compliance rate with the order over the duration of the order, again being gradually phased in. So with the higher suppression rate, we expect that you essentially have start with about 100% of the transmission rate on March 1st. By March 21st, you're only at 70% of normal transmission rate, and then continuing to decrease until you're about at 40% of the transmission rate in early April, and then it holds it constant thereafter. And we've got a full assumption sheet with the parameters, and the model itself is open source, so we'd be happy to share that for anybody who wants to deep dive into our assumptions and the model itself.
Okay, all that is great for a data nerd like me, Kip, but what I don't understand is, do you mean that there is compliance with the order through April 7th or through the end of May?
Thank you. It assumes continuation of compliance after April 7th. So in this model and in the models that we've seen, you need to continue to persist with the compliance, or else things just start going back up. Because unless you've completely eradicated the disease or have a vaccine for it, there's no reason once you take your foot off the brake that it doesn't start going again, or vice versa, whichever metaphor you want to use. So this assumes that the order continues in force until May 31st in this diagram.
Okay, thank you. I was afraid you would say that. Shifting gears, I can't remember if it was Jim or Angel talking about Bascom and Roosevelt being open 24/7.
It was Jim, council member.
And thank you. Has this started already, or when will it start? I don't know if Councilmember Perales already knew about this, but I have a CAC group, a community group that is still meeting virtually about the owl at Bascom, and so would like to have some details on that, and I'm happy to take it offline. I just wanted to put that bug in your ear.
we'd be happy to do that. It has not started yet. We're doing the preparation work. We are working with Home First to see how we could staff that up. Alternatively, if we need to use redeployed city staff that are not performing essential functions, that's an alternative. Our housing department is leading that effort. We will reach out to you and Councilor Peralez and let you know how our plans are going on that.
Okay, and if there's anything I can do to help, please let me know.
Thank you.
And then the only other thing I wanted to say is a big thank you to our chief and his team and everybody else who I know is getting very little sleep. And just as much as I can, I've been checking in with people and just saying, hey, thinking about you, hoping you're doing well. And it sounds like there's a lot of sleep deprivation with a lot of city employees, especially our PD right now. So I want to thank you, and just my heart goes out to all of you. Thank you.
Thank you, council member.
Thank you. Councilmember Foley?
Thank you. Whoa.
You want to try that again? Councilmember Foley, do you have the mute on?
You got me?
Okay, we may come back to you, Councilmember Foley.
Once she starts speaking, then it'll be fine.
Can I try again?
Go ahead.
Okay. Several questions for you. One has to do, first of all, thanks for the report, and I appreciate the efforts and time that you're spending in all of this and making us feel informed and helpful to our community. Chief, I have some questions for you. You had mentioned that you're doing some enforcement. How are you receiving notification of the businesses that might be in violation?
Well, two things, council member. Number one, we have those special cars that are going out there that are proactive also when they see businesses. We also have our patrol force that if they see businesses open, the protocol that they use. But one of the dynamics that we're using are two. Number one is the community can call 311 and go about it that way. And they can also use the district attorney's public portal that they have to report businesses. That is a way, once that gets underway, it's new, but once it's underway, I think it'll be very helpful for us because the DA's office actually has a team of DAs that vets the businesses, vets the potential violations, and then actually makes calls to them from the DA's office. And if they comply, then there's no need, and there's no need for PD. If they don't comply, then we go out there and we compile a list and we send those out to our cars to check on.
Councilmember Foley, I'm not able to hear you right now.
We are seeing her is muted in our system.
Okay, was there another question, Councilmember Foley?
Listening on her phone, but also on Zoom. And so Pam, you should mute one or the other, or undo one or the other. You can't do both.
Okay, how about if we go to Councilmember Carrasco, and we'll come back to Councilmember Foley if we're able to work on her mic issues offline. Perhaps somebody can text her with some direction.
Hello?
Hello? Hello? Welcome.
Hello?
Hi, Councilmember Carrasco.
Can you hear me?
Yes, we can.
Hi, thank you so much. I'm not sure where the feedback is coming from, but I'll make it short so that it's not as painful. A couple of things I just wanted to ask regarding the childcare. I know that Councilmember Arenas already talked about it, but you know, I've gotten some phone calls also about the community care clinics, our essential workers there. Want to make sure that Angel, that we're not overlooking the folks that are there. I know that they've been on the lines, and want to make sure that their families are taken care of, and that the folks there have some options for their little ones. So I just want to put a bug in your ear and make sure that we've reached out to them. I've promised the directors there that we would circle back and address their needs. So I don't know if you have anything in terms of community care clinics, if you could address that, or if they've reached out to you.
Councilmember, I have not talked to anybody from community care clinics. Right now, the strategy that we're standing up is targeting city essential workers. But what I'll do with this information is I'll reach out with our counterparts over at the county, who are also doing some coordination, and then we'll make sure that we reach out to these groups to make sure that we help come up with an appropriate resolution to that. But no, that has not been on our radar, but it is now.
Okay, thank you so much. I just want to say, city manager, and to all of those that are working day and night on this, I want to thank you so much. I've gotten a lot of feedback from my residents. My team has been on the phone with a lot of different folks. And really, I know that this is an unprecedented situation, and really I'm very grateful regarding the outreach that you're doing and how you are taking care of our most vulnerable, making sure that they're really being looked after and being taken care of. A couple of things that I'm just very concerned about, and I think that this is more of a question to you, Mr. Mayor. As I was listening to Angel and the very intricate and very complex system that's being set up regarding the supply and source, the food source, has anybody started to think about how we're going to protect really where the source of the source begins? And I'm talking about not the Harvest Food Bank and where they're getting their supplies, but really at the very beginning, which is our farm workers. And I've been reading and watching some news articles and some very disturbing information that they're not getting adequate health care, they're not being tested, they're not having any sort of protective gear. And the concern that I have is once that system breaks down, we're all in a heap of trouble. And if this is truly going all the way through May or possibly through the summer, talking about our source is going to be an issue. And as the mayor of one of the largest cities in the Bay Area, I would think that this would be an issue that really would be one that should be on our radar. And I just wanted to see what your thoughts were on that.
Councilman Carrasco, we're in constant communication with the governor's team, and if there are some specific interventions that you recommend, I'm happy to take them up to them, both myself as well as through our Big City Mayors group. And we've been constantly talking to senior members of their team about the immediate needs, everything from homelessness related issues to testing to a whole lot of other issues. So happy to take that up offline with you.
I'd like to have a conversation about that, especially since they're just down the street, Morgan Hill, Gilroy, Hollister. These are the folks that feed, a third of our country. And so if we could have a conversation about how the county can go ahead and even address that. But I think that it is incumbent upon us to really address some of those issues. So I'll take that offline and maybe we can have a conversation. But just as Angel was referring to the source, this is, I think, one of the areas that we should be concerned about.
Councilman Kraska, I think we lost that last sentence because of all the feedback. If you'd like to try it again or to text it, happy to try that again, that last sentence.
She said she'll talk to you offline.
She'll talk to us offline. Okay. Did you have any further questions or comments, Councilmember?
No, I'm good. Thank you so much, sir.
Okay, I'm going to go back to Councilmember Foley. Okay, let's come back to Councilmember Foley after we've had a chance to work on the mic issues, and we'll go around the room. Councilmember Perales?
Yeah, thank you very much, Mayor. First off, thank you for the presentation. Sorry, I'm not talking to the mic here. So looking on, I know that I've been kind of just following. We've got right now 130 people watching online. I think the information that you just shared as well is tremendously useful for a lot of people here in our city and our county, and got a lot of positive responses from last week's presentation as well that Kip was able to provide. So thank you for providing this level of information, not only to us, obviously, but to our entire community here at a local level. I'll echo the initial concern around childcare. My understanding in the first sort of briefing or update from the city manager's office was that the childcare was sort of a role we were going to be supporting the county in, not necessarily a role we were supporting our own employees in. And so I don't know if we can expand on what role we actually sort of, I guess, elected to play in regards to childcare and how expansive that opportunity can be.
I could start and hand it back to Angel, just sort of in terms of the genesis. When the county reached out to us and they raised a number of issues that they knew they were going to need support on, the top of the list was food distribution, necessity distribution. Also in that early conversation was a conversation around childcare, and we didn't know at that time if that meant the broader remit or a more narrow focus. And so we initially said, look, let's look at the whole broad picture and just begin to move. As we clarified with the county, we've sort of come into a sort of a three-piece approach. One is the county is going to take a focus on supporting their own healthcare workers and their own essential services. Two, they'd like us to do the same for ours. And three, the schools by and large have a very large role in the alternative childcare as per the governor's orders. And so at this point, that's sort of how the relationship is largely falling. But as always, we're keeping a close eye on where the risk is. And I'll let Angel, who's now leading this, carry in since he's been actually implementing it. But I want to give you a little bit of the prologue of how we got to where we are with now that Angel is leading.
Councilmember, I think what Kip framed answered most of the question. In terms of the pivot around our immediate focus on city staff, as we started to look, this last week was, I think for everyone in this room and a lot of people outside of this room, just an unprecedented kind of surreal type of event, right? And one of the things that became very clear early on in the week last week was that if we're going to be able to sustain this effort of response, we're going to need to make sure that we're taking care of those individuals in our city that are really on the front lines, right? And so we really wanted to start there. It's kind of, we applied a Maslow's hierarchy of need kind of filter, right? To say, hey, what do our first responders need first and foremost, and then we'll build back. And that's really the approach that we've taken. And I think that as we continue to kind of build this out and we begin to see that there's additional need, we're prepared to open community centers, libraries. Jessica over at the School of Arts and Culture has offered the plaza there. So I'm feeling pretty confident that we'll be able to take this to scale to meet the need. But first and foremost, we want to make sure that essential city workers, including police, fire, and others that are on the front lines, are kind of our first top of mind area of concern.
Okay, thank you for that explanation. Speaking of police and fire, I know we keep getting some updated numbers from our firefighters that have been infected, and most recently, and certainly made some news around a reserve officer. I got a lot of messages, people wondering if it was me initially before there was info out on who it was, but on obviously infected within the police department and an individual that had actually ridden with another officer, as reserves do. And so the questions that I had last week, which I understood certainly not necessarily directing towards Kip as our EOC could answer, but certainly were around the testing, right, and the ability to test individuals and the capacity of that. And Kip, you didn't necessarily right, have the answers in regards to what, you know, the county was capable of. I don't know if you have anything now to expand on that. I do know, and as well, Chief, while you're here, if you can be able to provide a little bit of update in regards to just the opportunities for some of our essential service workers to be able to get tested.
Well, I've got mostly good news on that front. Since we talked last, the county has instituted, in collaboration with us, a protocol that prioritizes the first responders who are symptomatic. And our experience of that has been that has been very responsive. We're able to pass those names along and prioritize those individuals, either police, fire, for testing. In parallel, we have also come up with a standard operating procedure modeled along that in collaboration with the county and put that into place for all city workers who are providing essential services. And our preliminary indication is that is also allowing them to be prioritized for testing. This remains the case that this is symptomatic testing, and that's a result of the restrictions that are in place in North America around our tests and the way we're allowed to use them, but we have finally begun to see that prioritization. And to date, it has kept pace with our needs, would be my characterization of it. It's been a little bit later than we would have liked, but it is now in place, and we've had a lot of people who've been very responsive to make that happen.
Councilmember, just to add that, you know, obviously we've done things in real time, and we have had, last Friday actually, we had to schedule some staff to get tested. They got tested within the next 24 hours. Results are coming back quickly as well. So the process so far took a push, but the process so far is working for us.
Okay, so that is positive news, but I think as a greater sort of concern, and really the best information that I've found so far was in a San Jose Inside article in regards to the county, I guess, finally giving out a more formal response on its inability, I think not necessarily due to its own, again, decisions here, but its inability to really test efficiently or sufficiently. And the comments were that their public health lab can only run a maximum of 100 tests a day, obviously meaning that these priority tests are coming out of those numbers, and that their statement was that local national testing resources are not scaled to the extent that they expected, and not everybody who's ill can be tested at this time, so that the capacity that we have here to test is just not enough. And it sounds like that's the case. It also sounds like the ability to understand and compile the data from other private tests that are happening is not necessarily making it in. So they know that there are individuals out there that have been tested positive, but not necessarily that data is not falling into these numbers that we're looking at here. Do you have any information in that regard? For instance, Kaiser, I know that we have in the city of San Jose, a lot of our employees, right, are members of Kaiser. Is that a data source that is there? Are they providing that info to the county on those, or is that also included in, as the county was stating, I think it was Betty Young as a spokesperson saying that data is not coming into them actually. So are you aware of any?
You know, I don't have enough insight to say one way or the other on this. I know that so I know the system is supposed to be that Kaiser is supposed to report in, and there's supposed to be a single database, but I don't have the visibility or transparency to say whether that's taking place or what the level of coordination with the private clinics is. I just simply don't know.
Okay, and is there, I know you mentioned one positive thing, which was around public safety, and I think it was a district attorney staffer or somebody from the district attorney's office that is a liaison within the EOC?
There's a district attorney hotline. You've got access to folks pretty directly through your, I think, police command center, which is connected into the EOC.
Okay, it sounded like there was maybe actually in a body, so there's not a body at the EOC.
No, we have a liaison over. We have a couple of liaisons over in the county EOC. We have one EOC to EOC liaison, and we also have a liaison around the feeding and food and necessity distribution. We're also trying to get a liaison around public information because we think that's the next order of business to be more tightly coordinated on, as well as modeling.
Would that include the questions that I'm asking now around some of this testing? Liaison for public information?
Yeah, and I've got a regular call with the county in 10 minutes, and I've got testing on that call. So
I'd like you to take that call. And thank you, Mayor, for talking about wanting to move these conversations in front of the consent calendar. I'll leave it at that. I really think we're still in the dark when it comes to this testing. And really, we're at a huge disadvantage at only being able to test at the county's capacity 100 individuals a day. And I think we need to make that a priority. And I would really like to see our EOC, whether it was to get a stronger communication with liaisons between the county and if need be, mayor, obviously, you know, efforts through the state, what it may be to, and this probably is a concern that's happening all across the country, but certainly I think that needs to be a major priority. And so I appreciate that that's on your call, and I'll defer to my other colleagues. Hopefully we can get you out of here in time.
Yeah, let me just acknowledge, you know, Kip has been pressing that issue about testing since about February 10th, to be clear. And we have no authority in this area whatsoever. And we have made it very clear that the county needs to get all the information from private sources to be able to have any eyes on the problem. And we will continue to assert that position. Councilmember Jimenez? You know, let me stop for just a moment. Kip, you said you need to take a call in 10 minutes.
Yeah, I think I'll step out and we'll leave the rest of the team to reply. Maybe if there are any
Okay,
questions.
maybe
from me,
what
I
we'll
can
do
take
when
them.
you do need to take a break, we got to do some switching out so we can get better equipment in here so we can come back to Councilmember Foley. So let's go until you need to go, and then we'll take a break. Councilmember Menace?
Yeah, thank you. Thank you again for all the work. One question for Kip is, I think there's a lot of information coming out. It seems like about 600, 700 or so plus confirmed cases in Santa Clara County. I suspect there's more, given what you said. What I'm curious about is, with those numbers, do we as a city get information as it relates to how many of those numbers are within the city and where within the city?
No, they have not been sharing the specifics with us on that. And essentially, you know, when we first started, we just assumed all of them were, just because that's the right way to respond. You can kind of break down the math on them and make some guesstimates. But at this level, I think the key is actually the level of underreporting of those numbers and the fact that it's thousands and thousands below. So we don't have the kind of visibility into geographic distribution, and unless we were going to be doing neighborhood-specific actions, we're just assuming that it's everywhere. So again, we're a little blind in this. It would be nice to have a bit more detailed information. We wouldn't necessarily share that publicly, but we would like that to be able to shape some of our efforts in the response. But again, the complete lack of at-scale testing has led us to kind of be groping our way through something we'd like to have a lot more visibility on.
Okay, but given the fact that the city of San Jose is the largest city in the county, we suspect that most of the cases are going to fall within the jurisdiction of the city.
Yes, I would suspect that, and that's sort of our working assumption, is we just assume they're all here and kind of assume that's the level of impact that we have to manage.
And assuming we knew exactly, you know, not exactly, but, you know, there's 10 cases in District 2 and X number of cases elsewhere, would that tailor the response a little differently as the way, you know?
And if we'd known that earlier, it certainly would have. Probably a little less important now, because we've moved, there's kind of three broad levels you can think of. One is containment, which is, oh, I've got a case, I know where it is, I'm going to track all the 200 people that you've talked to, I'm going to isolate all of them. That was where we were trying to be at the early stages, but with inadequate testing, we missed the window to do that well. Then we sort of were in mitigation, where we're like, we're going to slow it down, but it's going to be the same number. Now we're really towards suppression, where what we're trying to do is get that number low enough and low enough and low enough that we essentially are getting it, not only just slowing it down, but really dramatically reducing the numbers. And so when you're in suppression, one could argue that the need for tailored results is less important. However, the moment you come out of suppression, you need to have very, very comprehensive testing, because you need to know exactly where new cases are popping up, because you want to go back to containment. And so part of what we've got with this window, if we do it right, is we still need to scale up this testing dramatically, because when we pull our foot off of this, we could be successful, but only if we go back to containment. So at this moment, I'd like to have the data, and if we had it, we would probably think about how we do things differently. But at this moment, it's just all hands on deck and do everything you can.
Okay, and then with regard to the chief's comment earlier, because I've gotten texts and emails about folks playing, and I'll use the word organized sports in a very loose term, because it's a group of 20 guys playing flag football, for example, that maybe don't live together, right, as an example. But things of that nature, I mean, are you communicating with the chief as to recommendations as to maybe closing down some of the parks and things of that nature?
Yeah, that actually came up this morning. There was an email on that. I directed that to our safety officer and our Parks Department to make an evaluation with the safety officer to make me a recommendation, and actually a recommendation to Lee, because we're handing over the director to him for this next week, about how we should proceed. And I looped in Jason Dwyer in those communications so that we'd have the police perspective on that in order to make, for Lee to make a recommendation at the end of the day today.
Good. Chief?
Councilmember, if I can just add, if we get to the point where, we're really truly focusing on also not just businesses, but we really start the order towards, people congregating and things of that nature. That's why I made my point earlier about parks as an example. It's very difficult for a police officer to see a group. Are you living together? Are you not living together? Are you walking your dog? Or you're not walking your dog? And so all those things, it just makes it very simple for a police officer to say, if something's closed, you can't be here. Regardless what activity is occurring, in that it really just makes it much more simpler if that's what we're trying to accomplish.
Right. Okay. Yeah, and I appreciate.
The first step we have taken there, though, is to close playgrounds. So that we've put in signage around playgrounds. Obviously, that we think that's the highest risk. So that is a step that we've taken, but not parks as a whole at this point in
Yeah,
time.
and I appreciate the nuance, right? Just yesterday, I was out taking my 13-year-old son to play basketball. It's just him and I on the court. But those are some activities that I think, people would like to do, but I completely understand if it's easier to give a sort of blanket sort of restriction as to what's allowed. But I appreciate the challenges. One other question, Kip, and the last question for you, because I know you got to leave soon, is I know when Councilmember Davis was asking questions about the timeline and such, I mean, we're working under the assumption, at least everything I've gathered from all the information I've heard and seen, is that come April 7th or whenever this first sort of order sort of expires, that there is going to be something else in place after that.
Yeah, I cannot conceive of us being out of this by April 7th. There's no statistical probability of that being true.
Correct. Okay. So everything we're doing as a city, we're operating as if it's going to continue, because that is the way we should be.
Yeah, and again, we've been kind of putting this in 12-week chunks, not saying it's ended at 12 weeks, but the 12 weeks this is the most fluid changing situation I have ever been involved in my 30 years of public service. And so 12 weeks sounds like a long way away. And so, but that's what we're trying to do, is trying to game it, if you will, or understand it within 12 weeks. I cannot see us being out of that order and being safe by April 7th.
Okay, thank you. And Angel, you were talking a little bit earlier about standing as some kitchens and things of that nature. Some of those kitchens, just in some of the places you mentioned, are these commercial kitchens in different sort of sites and locations. I got word that a gentleman named Enrique Fernandez with Unite Here, some of his workers are probably not working in those kitchens anymore, or currently, that they're willing to help. And I think if I can connect you with him or give you his information, to the extent some of the workers that are familiar with those kitchens, already trained how to use those kitchens, can help in any way, I think that'd be beneficial. So I'll make the connection. All right, thanks. Okay with you. Thank you.
Okay, I see Kip is taking a break. Kip, you have, what, an hour on the COC call?
Yeah. Would you like me to come back?
If you have the ability to, yeah, I think.
Half an hour, I'll be back.
Okay, take your time. Thank you. Let's take a break now so we can switch out the telephonic equipment, and we'll get back ready to roll.
You don't like the disco microphones?
probably be a good idea, just to make sure everybody's on
How did we
there.
get you back, Kip?
We rescheduled the call.
Oh, thank you. Sorry.
Okay, so I'm gonna do a quick roll call. Jimenez,
Here.
Perales,
Here.
Dieppe, is that you? Davis,
I'm here, but I can barely hear Tony. I can hear Sam fine.
okay, I'll get closer to the mic.
What mic could you
Arenas,
need?
Arenas, are you there?
Yes, here.
Foley,
Councilmember Foley? Nope.
Carrasco,
Councilmember?
Here.
Okay.
okay, I'm checking the texts, and then I also, I'm gonna go back to Dieppe. And then Esparza's out for the moment. Camus,
Here.
Vice Mayor Jones,
Here.
Mayor Liccardo.
Present.
Okay, so I have not heard back from Dieppe or Foley and Esparza.
Councilmember Dieppe is here now.
Here, okay.
I heard here for both Dieppe and Esparza.
Okay, so Foley's the only one we haven't heard from.
Okay. So I'll text her now. Okay, and Councilmember Menace, I believe you had the floor, is that right?
I asked all my questions, Mayor.
Okay, great. Councilmember Esparza, and then we'll go Councilmember Camus.
Okay, oh, whoops, this has, so, I wanted to first off thank everybody for your hard work. I actually peeked into the EOC last week and, got to see everybody working hard and working through just being tired. So, I know you've worked several days, with no time off. And what I think is really impressive is that the team at the city has set up entire systems in place in a very short time. And so that's amazing. So I had a question again on the childcare. So we're creating this system and starting with our own workers. At some point, are we going to combine the system that we are setting up with the system that the county is setting up? Because they often involve the same partners?
Yeah, council members, so the county is setting up a system for their employees. They've actually entered into a subcontract. Boys and Girls Club is one of those vendors, and I think there may be one other. And so that's the system that they've set up. We're taking a different approach in that we're because we have internal staff that have expertise in this area. Plus, we have partnerships such as Head Start that have offered to also stand up childcare for 0 to 5 with us. We're exhausting those opportunities first. So I don't really see us kind of linking those strategies together, but I do see us definitely being really responsive and prioritizing the need of our workforce as it relates to childcare. And then in terms of childcare for others outside of the city, the governor in the direction that they've given through the state has been pretty clear in terms of the function and role of schools to help address that need as well. And so we're also hoping that they continue to do that, and we'll be in touch with them as well.
Okay, yeah, that's really important because setting up the system to start it with our people that need the support. As we expand that, one of the things I'm mindful of is the fact that we have a lot of this response is borne on the shoulders of people, making $15-20 an hour as a grocery store clerk, a DoorDash driver, and the like. And so if there's a way that we can help as elected officials help as we expand those opportunities for people throughout San Jose who are fulfilling those duties that we're all relying on, let us know. I mean, I'm eager to help where I can. And I had a question, and sorry, to follow up with you, Angel, on the supply chain management around commercial kitchens. Are we also working with community colleges and other large organizations that have the commercial kitchens, the capacity for storage and can act as staging areas for supplies?
Yeah, Councilmember, absolutely. What we're doing is we're also geo-mapping all the availability of assets that we know of. And what we're doing is at least for now, just again, forecasting kind of a worst-case situation, making contact with these different organizations and the owners of these amenities, one, to give them a heads up about our interests, and then two, to begin to explore partnership opportunities. And so, yeah, we are definitely doing that. As I mentioned in my presentation, we're kind of set up to meet the immediate need, but we're scaling up, assuming the worst-case situation. And so, yeah, everything is fair game.
Yeah, and I wanted to address briefly, because I know everyone's aware of it, the need for scale. We had a food distribution in my district yesterday and had about 150 extra families than normal. And we'll talk later about the item for financial assistance, but they had 1,200 people contact Sacred Heart just yesterday afternoon alone. And so the need out there, I think, is just going to grow. Again, whatever I think any of us can do to provide support in making these systems as scalable as possible. But thank you for that. I had a question also for the police chief. So you took the extraordinary step of issuing a memo last Monday, right, or Tuesday? Monday. Are there plans, and we spent some time on this issue on Friday, and I think there was a lot of misunderstanding out in the community on what it meant, and a lot of fear, well, do I get pulled over if the city's enforcing open businesses? Does that mean I'm gonna get pulled over walking on the street or driving on the street? Has there been written guidance from the Chiefs Association or any of the other law enforcement partners in the community?
That's a great question, Councilmember, and it was on the 17th. As all of our days, I think, are just melding into one. I don't know if that was Monday or Tuesday, but on the 17th, we put out that memo. I have spoken with other county chiefs. I actually even spoke with Chief Bill Scott up in San Francisco during the week to talk about. He had called down to figure out what things were going on, and some departments are just handling it a little bit differently. Some are doing it internally, an internal message. Most are practicing the way we are, is from my conversations with chiefs. It's just a matter of if they've taken the extra step of issuing an order, which, in my opinion, in my department, I needed to put out an order. And so that's what we did. But it seems like most chiefs have that same stance, and that most that I have spoken to are just messaging that internally without necessarily giving an order, an official order.
Thank you. And do you expect that to change with the coming weeks at all?
I'm gonna have conversations with the county chiefs, and see what their views are with regards to that. Different chiefs, different communities, different priorities. And so that's the dynamic that we will have to work through. So I can't tell you that all would do that. I'd like to think all of us in the county are at least in practice doing what my order to our men and women is doing. But I don't know if the other chiefs are going to codify that decision.
Thank you for that, and thank you for issuing that memo. I think there's a lot of fear, particularly in the east side in general, and we don't need them being afraid of us, right? So thank you for doing that. And then just one last question, and Kip, this is for you. Thanks for coming back. So the public health officers in the multi-county area, I forget, all I can see is the Santa Clara County, but I know it's a multi-county area, have issued an order from the health officer directing all laboratories conducting COVID-19 tests to report all the test information, including positive, negative, and inconclusive results. Will we get that as well, so that just we can, again, for the transparency's sake, will that be something that we can have and maybe post on our website to kind of allay everybody's? fears?
That's the county's decision on whether we get that or whether that's displayed. They have not been sharing that level of data with us. They've been sharing the top line results, and if that now is the aggregated result from all of those, they will share that at the top line, and we will continue to, as we have been, be completely transparent with what we know that it's publicly shareable. But at this point, they have not been giving us that level of detail.
Okay, that's helpful that we can follow up on that. Thank you.
Thank you. Councilmember Camus?
Thank you, Mayor. Thank you for Dave and all your staff. I think you guys are doing a great job undertaking, things that you're not responsible for, like food distribution and things like that. So I really appreciate your efforts. I have a question on homeless care. And I don't know I think Jim was answering those questions. Look, I know we're not abating camps, but a lot of the camps are looking like garbage dumps, and I don't know, that in itself is not a hygienic way to live. And if you drive by some of these, like for example, on the way here today, I'm an expressway and Highway 85, which is technically in District 9, but there's only 2 tents, but the entire water basement is full of garbage, just litter everywhere. I don't know, is there anything going to be done with that?
So, Councilor, I appreciate the point. What we've done is that the Rapid Illegal Dumping Response Team was deemed non-essential, but we've redeployed them to work with the homeless team and kind of the anti-litter program. And they will be focusing around encampments, given that we're not abating encampments, to provide additional level of sanitation. We've put out at large encampments, washing stations, porta potties, and we want to put with them additional kind of garbage pickup, illegal dumping pickup, and those types of things. So if you want to identify them and get them into us, we can certainly have that team that has the PRNS anti-litter and a redeployed illegal dumping rapid team from environmental services connected into them to address those types of things. We agree with you. We believe it is part of kind of hygiene and good sanitation. So that's something we would continue to address. We've kind of deemed that essential during this period of time.
Thank you. I think I have 2 staff members listening, and I hope Shane and Amal and Michelle are actually taking notes on this. I appreciate that. And there's several areas in my district that I'll give. This is for the chief, and I want to thank the chief for all his efforts. I did hear some statistics from San Francisco recently on actually crime going down, which kind of I guess I had an idea that crime was going to go down for burglaries, but also violent crime went down in San Francisco. Are you collecting statistics on domestic violence? What's happening in ours? Did I miss an announcement or something? You're smiling like I missed something.
There was actually thank you, council member. Actually, I'd love to talk about it regardless, but yes, there was an article that came out with regards to what we did is we knew that our community was very apprehensive with regards to the shelter in place and as it pertained to crime. And so what we did was we compared our Part 1 crimes, which are our major crimes that we have that we report out to the DOJ. And generally speaking, those are the type of crimes that aren't necessarily underreported because they're our most major crimes. And so we compared the week, we compared up till Saturday from the 15th to, I believe, the 22nd. And we compared that week to other weeks of the year and compared it to that same week in 2019. I don't have the statistics directly in front of me, but I can tell you that violent crime in that was dropped by nearly 46%.
Wow.
Property crime dropped nearly 36%. Every Part 1 crime across the board. No, we didn't. It didn't capture the homicide, unfortunately, that we did have, but it was 1 homicide compared to none But again, as I've spoken before, that homicide could have happened last year at the same time. But with the exception of that, again, violent crime dropped nearly 46%, property crime dropped 36%. Every category other than that dropped dramatically. And so, the message that we wanted to send to our community as well is that I know, and sports analogy, as you all know, but we're in the first quarter, and I get it. But I'd rather our statistics start here with a drop. It shows, obviously, that the city is not going to turn on each other. It shows that our men and women are out there proactively being visible, and they're continuing business as usual. And to me, it's one of these things that gives our community hope that we're going to get through this. And so the numbers are positive. It's very early on. We're very hopeful it continues. Obviously, it's a byproduct as well as the shelter in place, and that I think people are, for the most part, heeding the ordinance. And so, but in answer to your question, yes, we're tracking it moving forward, and we did track the initial week, and it was very positive.
That's fantastic news. I had theorized that domestic violence might be up. I know how much my wife likes to have me home 24/7, but I'm super happy to see that the statistics are 46% lower.
Councilmember, just one thing I will say this in the last couple of weeks is we've seen a drop. Right?
Yeah.
One of the things that we're not jumping up and down as a success story when we see necessarily drops in domestic violence as an example, because we know that that's a very highly underreported crime at times.
Yeah.
And so, yes, on one hand, we've seen drops, but on the other hand, we have to continue our messaging to ensure that we're out there, that our community knows we're out there, and we want that reported. But yes, overall, the numbers were very positive for our city. We should, as a city, collectively, should be proud of ourselves for this last week.
Absolutely. It shows that our citizens are, doing okay, and I really appreciate that. As far as, I think we were just talking about the post-certified officers, the ones that are in our, I forgot the officers. They're basically volunteering, like
Reserves? The
reserves. Perales, are we? I know that you're stretched, but are we able to use those officers in a solo car?
No, we cannot.
No. Okay. All right. So. Yeah, and thank you, Chief, for your work. My next question is on the statistics that we got up, and I noticed that we were projecting all the way out to May, and I know that this virus has an incubation period of 2 weeks. We're asking people to shelter for 3 weeks. I know that there's not enough testing going on, but let's say that we're missing a whole lot of people that haven't been tested, but they recover, right? Because it's going to be 3 weeks from now. Those people who we've missed testing will have recovered by then. I'm just concerned that we're going to turn this pandemic into an economic pandemic if we project all the way out and keep people in their homes till May 31st, which I know that small businesses will not. I mean, they might be able to go away for a month, maybe a month and a half, but I think I'd like us to start thinking how we can work after what happens after this pandemic, and what economic future can we expect after? Because I think we need to start looking about who can go back to work. What businesses can we expand into after these 3 weeks are over, or the 4 weeks, or wherever we extend it. Do you have any realistic projections, past April 7th?
We're sharing with you, kind of our best thinking on this. We're going to take a deeper dive in this as we go. I would say just 3 things very quickly. One is that the public health orders are issued by Dr. Sarah Cody, and she has complete authority to issue those orders and to extend them. And so in many ways, we are reacting to the decisions that she makes. I would say so far that she has made very good decisions for us in terms of putting these orders in place early and giving us a chance to bend the curve. She will have a lot of thinking and a lot of guidance on how we come out of this. So we'll be looking to her leadership on that and her direction on that. We do believe that the economic consequences are extremely serious and severe, and we are as concerned about those as we are about the public health consequences. And so, as you can see, a whole stream of work around the at-risk work is really focused not just on the health risk, but on the economic risk, especially small businesses, especially hourly workers. And the longer that this goes on, the harder it is. So those points are very well taken, and that's exactly why we're spending the time trying to think about this and model this, as well as we've mentioned, trying to take advantage, if you will, of some of the opportunities that are created by the crisis itself. What are those jobs that can keep going? We've seen, for example, a local distillery that has retooled into manufacturing hand sanitizer, and so they switched out from whiskey to hand sanitizer, and we're now in the process of contracting with them to provide reliable source of hand sanitizer for all of our city employees, and we are extending that offer up to the county and others. So those are interesting examples where very entrepreneurial folks have taken the lemons and turned them into lemonade. And that doesn't work for everyone, and it won't be at the level of the economic suppression that we've seen, but we continue to be supportive of small businesses and thinking entrepreneurially. But to your point, the longer this goes on, the harder the economic consequences are as well. And so there's a balance between them.
Yeah, no, I appreciate that. And, I think it's important to start thinking of businesses that we may be able to allow to go back to business, such as commercial construction, for example, where people are still going to be working far away from each other, just like residential construction, and perhaps, anyway. So
maybe I could just jump in there, because this is a battle I've actually been in the middle of quite a bit.
Okay, great, Mayor.
Yeah, so you probably know that under the state order, actually commercial construction would be allowed.
It would?
Under the county order, it would not be.
Okay.
And there's a difference of opinion between the county and the state as to whose order trumps. And we're trying to resolve that now. And so I've had very direct conversations with the governor's senior team, and we continue to be in those conversations so that hopefully we can resolve this and provide clarity, because I know there are a lot of people right now. Look, we know that this is impoverishing a lot of folks, and we'd like for everyone to stay as healthy as possible and to impoverish as few as possible. And so your point is well taken.
Thank you, Mayor. Thank you for working on that. I appreciate that. I have no more comments, but again, my sincere, commendment to all that you guys are having to do and pick up the ball for. Really appreciate your efforts, the whole staff. Thank you.
Thank you. And Vice Mayor.
Thank you, Mayor. I was on a conference call last Friday with the National League of Cities with the council presidents and vice mayors, as well as staff. There were about 28 individuals on the call throughout the country, and I had the opportunity to talk about all the things that we're doing here in the city of San Jose, and what your team is doing, and Chief, what you guys are doing on the front line. And it became very apparent that San Jose is setting the gold standard in terms of how to respond to this crisis. So I just want to let everybody know that that's been communicated nationally of what we're doing. Kip, you mentioned in terms of how we communicate or messaging, and I read an interesting article just yesterday where it segmented different groups and how they respond to crises like this. And one group was what they call over-responders. They're the ones that are running out, buying up all the toilet paper and hand sanitizers, and they're running around with their hair on fire. There's the under-responders, who are the people we see in Florida, crowded on the beach or having, soccer games and taking this whole situation lightly. And then there's the middle group, which they call the Goldilocks, which are taking it seriously, doing what they're told, but not overreacting, not panicking, and not taking it too lax. I look at my communication that I've put out to my community. I've also looked at the communication coming from the mayor's office and my council colleagues. And it's apparent that that communication is really targeted towards that middle group, the Goldilocks group. And it's very apparent that we have to have different messaging to appeal to the over-responders and the under-responders. So can I get your thoughts, guidance, and input in terms of how we communicate to those different groups?
I'll just say a couple of things top line. One, I'd love to see the article, so please send it along.
Okay.
That's the sort of thing we like. We are in part of the reorganization that we did over the weekend includes enhancing our EPIO's capability. The EPIO team has been doing a remarkable job getting information out, but they haven't been able to sort of step back and be a little bit more proactive and think about sort of market segmentation, if you will. And that's what you're talking about is who are the key audiences that we need to get to and tailoring the message to them. So you bring up the example of the under responders. We've also been thinking about, well, you know, if seniors are at risk, seniors may need a different set of messages than the general public. And seniors who are primarily Vietnamese speakers or primarily Spanish speakers may relate to a completely different set of messaging than what we're putting out in English. Not just a translation of the messaging, but a different type of messaging that takes into account cultural context and values and ways of thinking that are different between those groups. And so hopefully what we're hoping by standing up this group, including we have a contract in place with a group called Behavioral Insights Team in Great Britain that works with Johns Hopkins, which has the premier public health institution in the world, to be able to rapidly test different messages against different demographics and different groups. So we're going to be rolling that out over the next week and increasing our capability to develop more tailored messaging. Again, I'm not going to promise the moon in the first week. Our focus will be on those who are most at risk and the core messages we need to get to them around things like shelter in place. But I'd love to see the article so we can take that into account as we begin to craft messages and get those reluctant folks into the room or back in their room, as the case may be.
Great, thank you. Chief, your men and women are on the front line. They don't have the luxury of engaging in social distancing. So first of all, I just want to know, how are they doing? How's the morale? How are your folks doing in terms of meeting the challenges of this crisis?
Councilmember, thank you for the question. They are amazing. You know, luckily, we started preparing for this because we have amazing people, men and women that work in this police department. We started prepping for this long ago, like weeks ago. And with messaging, getting plans in place as to what we were going to do and had a plan for our men and women. They've just responded wholeheartedly. I've said this before. I've done some interviews in the last few days, and they're concerned. For the first time, and I've said this before. For the first time in my career, our officers, our men and women, know that they're going to face dangers out in the field. But for the first time that I know of in the nearly 3 decades I've been here, there's a danger that they may actually have to take home with them now to their families, which that necessarily wasn't something that was in the front of their minds before. But I read the watch commander's entries and the logs. It's business as usual. Just the other day, armed robbery occurred at 2 7-Elevens. Officers did an amazing job, arrested them both. One went in a pursuit. I'm about to tweet that one in a little bit because I've told people that this department is fully operational. No one's going to take advantage of this city. Our men and women are not going to allow that. And that's just yet another example. The other day, I walk into the locker room. There's an officer putting his gun belt on, and I asked him, how you doing? He says, I'm doing good, Chief. I go, how you feeling? He goes, fantastic. And that's just the spirit of this department. I'll be honest with you, although they know and recognize what's occurring outside of them, I swear, if you came into the building and you spoke to officers and talked to those officers, you would ask yourself and wonder, do these people know what's going on outside? The sick calls are at all-time lows. Our dispatchers are amazing. Our CSOs, our civilian staff that's there. It's just, I've seen. They're not weakening; they're strengthening, and it's amazing to watch. It's amazing to see. It's good. So I appreciate your question. But it's inspiring to see the work that they're doing.
We already talked about prioritization on testing. Are there other things that we're doing to protect our officers, or that we should be doing to protect our officers against this virus?
One of the I'll say this: we're constantly, our team, we've stood up our own COVID operations team as well that coordinates with KIP and their folks also. And we're in constant contact as to what the standards are nationally. And we get updates from Major City Chiefs Association, who's in constant conversation with the CDC about what things that are going on. We really like to think that we're doing all we can. You know, one of the major things that we did was breaking up our briefings. One of the best parts about our police department is that it is centralized. And one of the reasons why Chief McNamara, back when he came here, that made it centralized is for communication. Because I have the ability to communicate with the entire department, every single man and woman on this police department, sworn, civilian, what have you. I can communicate a message in 1 week to the entire organization. There's a lot of chiefs that can't say that. But one of the negatives of it is, you know, when you're dealing with something such as this, we're trying to do everything we can to decentralize. And so that's a byproduct of just who we are, and we're having to work through that. And so that's why we're acting outside the box in a lot of different ways. Our Bureau of Investigations is basically doing shift changes. Every unit commander has one set of detectives that come in the morning and another set of detectives that'll come in the afternoon, and they'll flip-flop working from home as best they can. And so I believe we're doing a lot. I mean, I will say this. The one thing that I wish the technology was there, because the answer I hear, although I see other people getting tests that are asymptomatic, but I've been told that, you know, in order to get our testing, you have to be symptomatic. Obviously, in public safety, when we quarantine officers that are asymptomatic because they had exposure, it would be fantastic if we can get a test done as quickly as possible so that if we know that they're asymptomatic but they don't come back positive, we can get them back online. If there's one thing, and I'll believe what I'm being told, I wish the technology was there to have accurate reads on asymptomatic individuals. But short of that, I think we're staying on top of everything we need to with regards to the equipment for our men and women, the training for our men and women, now the testing for our men and women, and you know, I think we're on the right track.
Thank you, Chief. It's inspiring to see the work of our frontline workers and employees, as well as the nurses, doctors, and all the individuals in the medical profession, the sacrifice and dedication that we're seeing. So thank you for what you guys do.
Thank you, Councilmember.
If I could add just one quick word on that, just to show how kind of EOC works with the field and making sure that they're able to do the hard job that they do. One of the things we're concerned about is the continuing supply of personal protective equipment, PPE, particularly the masks. And so in addition to the stockpile we have, in addition to the normal course of business of going and ordering through the county and through the state and trying to get as much as we need, we've also been very creative, and we've got requisitions underway directly with suppliers in China through our networks, including some that the mayor has personally turned us on to. And so we will continue to do everything we need to do in the EOC to think ahead of the curve and make sure the men and women of the force have the equipment they need to be safe. And so that's kind of just want to illustrate that, both as to echo the chief's words around creativity and to show how we're trying to think ahead so that they don't have to worry about limited use of PPE and other things like that, which would be very difficult.
Thank you. And really want to echo that thanks. I know that we're really blessed to have an amazing team right now running the EOC. I just really want to say thanks to everybody who's involved in this, from the top to the bottom, Dave, Kip, Lee, Jim, Angel, Chief, everybody. I know that there have been a lot of hours invested, and I've also been engaged in a lot of conversations with people in other cities. In fact, literally now it's 3 times a week. It was actually 5 times a week on the phone with the mayors of 13 major cities throughout the state, all of us comparing notes about where we're at. And I can tell you, as bad as we know this is, we're well ahead of the curve in terms of how we've tried to get ahead of this and try to do everything we can to help cushion the blow for our residents. And we know this is tough for a lot of members of our community. Kip, I wanted, if I could, to unpack the diagram. And I know that you have offered many disclaimers here that you are cutting and pasting a bit from models from other sources, as we must. We're not the experts, and we're relying on data that other people are giving us and so forth, and so I totally get it. I just want to make sure I'm super clear about what we think is going on. And what you have is the estimated ICU beds here and you have two horizontal lines.
Yeah.
And I know that, I recently had a conversation with Jeff Smith and others at the county that told me where I think the ICU beds are, which is somewhere south of 400.
Right, and that's the lower line you see of that
Okay.
bar.
And the higher line is what we think we can get to when we open the Santa Clara Convention Center and lots of other
Not
things? or-
necessarily. The higher line was simply the estimate based on us,
On the state.
countrywide averages of what
Oh.
we might see. Again,
Right.
we don't run the healthcare system, and so our knowledge of the ICU bids is based on what the county tells us. So that's sort of our fudge factor there.
Right.
But what you see, if the bottom line is the existing capacity, then you'd need to surge from the bottom line all the way up to that the lightest of the three lines in
Yeah.
order to be able to hit the capacity needed with this model. And that's not fully taking into account utilization rates and all of that. That kind of modeling the county has a much better handle on,
Yeah.
and will be running in theirs. But this at least gives you a useful proxy to say,
Agreed.
hey, a lot of stuff is coming, and it's more than we can handle unless we surge.
Right, so all things, if we assumed all the assumptions were true, ceteris paribus, all that stuff, it's all baked in there, then the lines where the lines cross, which is the really important thing for us, right? That's the point at which the medical demand exceeds the capacity of the county. Then
Yeah.
theoretically, that's about a week off.
A little bit, yes. Without any surge, you're looking at about a week.
Or less.
Yeah.
Okay.
Yes.
And I know they're working to try to expand the number of ventilators and beds and all that, and we certainly hope they do.
Yeah, they have a surge team that they've put together.
Right, but even if they were to double that capacity, which is quite an undertaking, and, we are checking in with them, I'm hoping to hear more about their progress on that. It's clear that even in the best assumptions with high suppression, we are going to exceed that capacity.
Yeah, they're going to need to surge, and they're going to need to surge big. One of the consequences of the efficiency we've seen in our healthcare system over the last 20 years has been a dramatic reduction in the number of bids overall
Right.
and the ICU bids per capita. So if you look at Italy, which of course we're all looking at now, they have about 3 times as many ICU bids per capita as we do, and they're completely overloaded. So again, I'm not a fear monger. I don't like to scare people, but our estimates are that we're headed into a situation where our healthcare system, as we know it, will not be able to handle that without triaging in a way that means turning people away who need very important health care.
Right.
So that ability of the county to surge into that is, I know, their top priority and what they are working on, and we need them to do that well and wish them the best, and are here to step behind them, and Angel and Jim and team, on things like finding capacity for overflow, discharge of people who need lower level medical care, all of that. We may be looking at thousands and thousands of spaces that are required to deal with people who cannot be hospitalized but need some lower level of attention.
Right. And I know you're relying on a lot of assumptions we're all flying blind here without enough testing, but the R-naught assumption is 2.2, is that right?
Yeah, this is so the R-naught is the level of transmission, and the assumption in this particular model is 2.2, which is actually lower than what the state assumption is, as you know, which I believe is 2.6.
Yeah.
So again, part of what we wanted to do is, if we're going to put these out, is not to exaggerate.
Right.
So if anything, these things are perhaps a little bit dialed back, at least on the bottom curve. Again, that top curve is not going to happen, because that's people continue about their daily business. That just simply will not happen. But the bottom curve is not in any way an extreme exaggeration. We've even estimated hospital stays at only about 4 days for the severe cases. That's probably a very low estimate.
Okay. Yeah, I guess where I'm going with this is, clearly the actions that we've all collectively taken, the county and everyone, is saving a lot of lives, is going to save a lot of lives, and that's important. But I guess it is important for us also to be really aware of the fact that even if the county is able to double their ICU capacity, the need is going to expand to the point that exceeds that capacity. And we may be underestimating that demand based on the transmission rate, that assumption that we've implemented in this particular model. Is that all fair?
That's all fair based on what we know.
Okay. And then finally, what I don't understand very well is what percentage of infected people do we think will ultimately need, I guess we call it an ICU bed. I think what we really mean is a ventilator. Is that right?
It's both, but the ventilators have been one of the critical factors in this. Almost all of the critical patients will require ventilation, and many of the critical patients will require ICU. So it's a combination of both.
Okay. And you have any sense of what percentage of infected individuals will need that level of care?
Yes. Again, there's a lot of unreported cases, and this model actually takes into account the unreported cases based on some initial modeling. But if you look at sort of the typical case count that we know from the experience in China and Wuhan, you have about 80% that are mildly symptomatic. So that leaves you about 20% which are severe and critical. It is the critical cases, which is about 5% of the cases, which essentially you can assume require an ICU. So if you have 100 people, five of them will potentially require an ICU or ventilator.
Got it. So when we're at, and you were looking at projections of around 20,000 infected at the high end today.
Today we were looking between 9,000 and 19,000.
Okay.
Is our rough estimate of the actual infected today, and not at their sickest point, but at various stages along the infection rate.
Right. So that may be days off. Okay. Yeah. All right. Thank you. That's really helpful. In terms of our own stash of PPE, I know that the healthcare workers come first here, but I know we need it for everything from food delivery to our first responders. Who do we refer to potential source? If I've got a potential source, we've been in the past. I've been pushing everything to Chris Wilder at the Valley Med Foundation because we know they need it. But is there someone who can communicate to all of us as council members, as we're constantly running into people who say, "Hey, if I've got a few thousand gloves, who can I give them to?" Who would be that person we talk to?
I would say two things. At the moment, Lee and I are good points of contact within the city. I can find a request from the county on who they'd like to have as a point of contact. James Williams, who's Lee and my's counterpart over in the city in terms of the Emergency Operations Center director on most days, and others, has actually been very responsive recently on this. We've been able to get in contact with their sourcing folks. So everything that we've gotten in terms of things like Foxconn and things like the American Chamber and others, we've passed along to them. They've now have been feeding that into their system. We haven't fully baked those all the way through to an actual order, but we now have a good channel of communication with them, letting them know. I think they're particularly interested in potentials for ventilators as well as and masks.
Yeah.
So we're feeding our information as we get it along to them in real time.
I was actually more focused on the city's own inventory.
Oh,
that
sorry.
is, I understand, because I've been supporting the county, and I want to continue doing that, but I'm just wondering, where there's an urgent need for the city, and someone comes to me and says, I got something, I just want to understand.
Yeah,
first.
that's us as well. So we have a logistics unit that reports, which is a separate section of the EOC, and they are responsible for sourcing our PPE. They work tightly with Jim and Angel's operations folks because they're the ones who are using the PPE along with police.
So should we just
fire.
send the email to Jim?
No, he's not the logistics lead. It's EOC director would be the place to start. We'll get it to our logistics section coordinator. Sorry about
All right, I'm just sensitive to overloading your inbox here.
We're keeping up.
Okay. Hey, Chief, you mentioned something about computer stores in terms of businesses that are operating might be violating. I was under the impression they might be exempt since people maybe need computers to work at home or learn at home or whatever. Am I wrong about that?
You know what, Mayor? We gave them a warning. I don't know, quite frankly, if they are exempt. I'll tell you this, Mayor, I'll be frank with you and tell you that as we go through this, more and more businesses that we never thought were, quote, essential end up being deemed essential.
Yeah.
So it's a learning curve for all of us.
Yeah, I get it.
But I don't know exactly for sure what particular one was.
Okay. Fair enough. I know we're all trying to muddle through this. And I know that R.J. Patil over at the state used to be the chief data officer for Obama. he's offered cities the ability for us to be able to assess compliance with the stay home mandate. Are we taking advantage of that at this point, or is there someone we can refer that opportunity to?
Yeah, we've, I think we both are interested in that. We've got the futures team that produced this is also working with Stanford and Harvard on some modeling. They have some ability to, and techniques to assess compliance, but I can also pass, you pass that information along to me, Mr. Mayor, I believe. I don't have the contact information, but you have the name.
Oh, let me get it to you.
And I'll sync up with your team on that to make sure that as we learn about the opportunities for assessing compliance, that we're coordinated with law enforcement.
Okay,
and
great.
if it's something that we'll hand over to them, we'll hand it over. If it's something we'll run for them and then hand across, we'll do it that way.
Okay, great. And then finally, on opportunities to expand emergency housing capacity, a couple people have come to me in the last 24 hours saying they're willing to help who have a lot of experience in this area. Who can we talk to directly about that?
You can send that to me. We're going to have our first future team meeting on the homelessness front tomorrow, so we'll pass that along. We'll
Great.
get the teams being stood up tonight.
Okay, wonderful. I'd love to talk more about that offline. Okay, any other questions for our hardworking team? Okay, we don't have any cards specifically on that item, so I wanted to say thank you, everyone.
Yeah, and thank you, Mayor, for allowing us to present, and I really appreciate the questions from the council.
Yeah, thank you, everyone, for ongoing engagement. Okay, there are no other questions. Let's go on to item, let's go back. We're going back to item 2.22. I interrupted an important question, Councilmember Sparks, and I'm sorry for doing that. I just was worried about our time issues
Yeah, I
on
get
the
it.
Brown Act.
My feelings are hurt. I understand. My question was around the last, hold on, I'm pulling it up. The last sentence of the supplemental memo that was issued today. So that says documents such as staff reports, ordinances, and resolutions would not need to be posted 72 hours in advance of the meeting. And the point that I brought up was putting explicitly some guardrails on that so that it is specific to COVID, or that we outline exactly what we're exempting, so that in order to avoid not posting information that the public is still expecting and looking to get online. So that's a question for the city manager.
So I think our intent is obviously to comply with the Brown Act. I think what the goal here is if we don't want those provisions, though, to inhibit our ability to get information out, and so that we can still proceed with the item if necessary. So certainly appreciate your comments, and I think our intention is to comply, but wanted some flexibility here to be able to present information, on a more urgent basis.
So as we've just heard, that this is an issue that can go on for several months, right? The examples that we saw went through May in the statistical examples. And so, I'll be blunt, I certainly can't support something that is a blanket sort of exemption that could go on for months. And I'm looking for some guardrails and some guidance that would provide more specificity around what would or would not be posted 72 hours in advance.
So I guess we'll have to give that some consideration. I'm not really thinking of a scenario where we wouldn't be able to comply. And certainly with, on our agenda, we would expect to have, we're not going to have a lot of things coming through that are non-kind of COVID related, but there probably will be some. And certainly with those items, I see no reason why we wouldn't be able to comply. I think we were here more focused with just some sort of urgent scenario where we needed to get something on the agenda and weren't able to kind of comply with the 72-hour requirement.
So what would be another way we could word that sentence?
You want to repeat the sentence so that way it's clear to everyone?
Yeah, I'll repeat it. It's the last sentence in the first paragraph of the supplemental memo, and it reads, documents such as staff reports, ordinances, and resolutions would not need to be posted 72 hours in advance of the meeting.
Could I offer a suggestion?
Please.
That perhaps if we were to insert the words relating to the, to actions required under the emergency, the state of emergency, something along those lines?
I think that would work, and I was also going to suggest that maybe there would be some sort of waiver provision that the council could invoke if we weren't able to meet that requirement, but I'm
Yeah,
fine.
the problem is that the Rules Committee, you would usually waive it, but the 3-day period is, you wouldn't have anything, you may not have anything on the agenda by the time the Rules Committee comes up, because the 3-day period will be Friday.
Yeah, and I was just hoping that maybe the council would have that option, because certainly the default would be, we just wouldn't proceed with the item. We would move the item to the following week.
What about the language the mayor just offered up?
I'm
That seems
totally
pretty-
comfortable with that language.
Yeah,
Yep.
I would be too.
Okay.
So thank you, Mayor.
Okay.
So just for clarification, so we're saying that anything that's not COVID would have to be 72 hours? Anything that is
Correct.
COVID would not be?
Correct. So would I need to make the motion to make that amendment to the sunshine policy modification?
I think it probably worthwhile. Not that we plan on defying,
Okay,
but it's probably worthwhile.
so I'll make the motion to pass this item, the modification to the Sunshine Public Meeting noticing and document posting requirements to the Brown Act with the amendment to the last sentence of the first paragraph to change it so that it reads, documents such as staff reports, ordinances, and resolutions would not need to be posted 72 hours in advance of the meeting unless related to, if related to the governor's emergency or the county's emergency orders. Did I say that correctly?
I would say the
Mayor?
cities.
The state of emergency.
The state of emergency?
Yeah,
the
because
city
there are
state of
several
emergency.
orders out there.
Yeah, unless it's related to a state of emergency.
Yeah, thank you.
Exactly, I knew what you meant.
Yeah, well, Tony's got to know what I mean. All right, great. Thank you. That's the motion.
Thank you, Councilmember. Councilmember Carrasco? I believe you want to be heard on this? I don't think she can hear me, though.
Can you hear me?
I can hear you now, yes.
Oh, thank you. No, I'm good.
Okay, you're good. Okay, great.
Was that a second?
Mayor, it was me. I raised my hand.
Okay.
Okay, any other questions?
Yes, Mayor, may I speak? This is Sylvia.
Yes.
Wonderful. So I wanted to thank you, Councilmember Esparza, for bringing those points up. I think this is the closest thing that I'm going to have to relate to this item. As my team was working on publicizing more information on the COVID-19, they ended up working with city clerk and city attorney's office last week on the question of whether we could legally put any information, any ads on the Evergreen Times. Evergreen Times is our local newspaper that continues to run. And the question is, can we have it as a paid ad or pay to promote our information on Facebook so we can get more folks connected? And in both of those cases, the council policy 0-38 didn't allow for that to happen. It only allows it when there's an event or when you're recruiting staff or when you're paying, you've paid it to a nonprofit like through a fundraiser. But there isn't an opportunity to do it as a PSA. So I wonder during, declared emergencies if we could have the use of advertising to help get our PSA information out.
Is that a direction for us to look at it and bring it back.
And just to be clear, this just has to do with PSA relating to the public health, public safety issues. Is that right, Councilmember?
Yes, because because if we pay to have an ad, well, we can't legally pay for an ad to so say if I wanted to put it in the Evergreen Times, I can't put it on the Evergreen Times because the current council policy only allows advertising for us to pay for advertising, whether it's an event or whether we're recruiting for a position or whether we're paying to a nonprofit, like in a fundraiser, but it doesn't allow for an ad, which I think is, it touches a mass number of people and is more effective. So I wonder if we could have something that the council could take a look at and update it's council policy 0-38 so that we can allow public service advisory advertising during declared emergencies.
So thanks for raising the issue, Councilmember. I think the suggestion is that we come back next week to consider that, I suppose, as an
Right, we can look at that with the city manager's office, and we can come back next week with a proposed revision to it, and you could adopt it next week.
Next time.
Wonderful.
Oh, excuse me, I'm sorry.
Yeah.
Next time, since we don't have a council meeting next week.
Tuesday after this.
Sure. Thank you.
Yeah, thank you. And I just want to,
And if he doesn't have a second, I'd like a second.
I think we got a couple of them.
I did not get a second.
Oh, you didn't?
No.
Okay. I thought Vice Mayor
now we
and then
have a few
Councilmember
seconds.
Crosco and then Councilmember Arenas, so we have a lot of seconds here. We'll let Tony pick. Okay, I just want to offer some context from my conversations in other cities. Oakland canceled all their city council meetings. Sacramento's got council meetings, but they literally allow public comment only by phone or email, I believe, or I think only by email now I think about it. So I know we're doing our very darndest to keep the doors open to the community because that's important without physically opening the doors. Although we obviously still have people that are here for public comment in a room next door. So I just want everyone to be aware that this is a hard thing for everyone to manage right now. And I think none of the cities have really figured it all out. So we appreciate everyone's patience as we muddle ahead. All right, any other comments? Okay, let's vote on this item, which is 2.22, the motion with the amendment offered by Councilmember Esparza. Councilmember Perales.
There were two public comments on I don't know if that meant they were here or just on Granicus.
Okay, so there are public comments on Granicus. Tony, how do we proceed?
I'm not signed into my Granicus, but if they're on Granicus, they're already posted to the web, so we don't need to read those out loud
Okay.
because we
They're part of the
downloaded
public.
all the comments and we uploaded them to the webpage.
Okay, those are part of the public record.
Yes.
Okay, thank you. All right, let's vote on that item. Tony?
Okay, Jimenez,
Yes.
Perales,
Yes.
Diep,
Yes.
Davis,
Yes.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Yes.
Camus,
Yes.
Crosco,
Yes.
Vice Mayor Jones,
Aye.
Mayor Licardo.
Aye. Thanks, everybody. Okay, so we have the remainder of the consent calendar. I just want to make a single comment, not to pull any item off, but just on 2.17. I hope everyone has a chance, if they haven't already, to read through that thoroughly and see the presentation as just an example of transformative leadership inside this building. I think there have been a lot of turnaround stories in City Hall over the last several years. I'm really grateful for the hardworking people we've got who have really rebuilt this organization in ways that are really attracting national attention. Rob Lloyd has clearly done that with IT and his entire team. And I'm really proud to see what they've done, and they are in fact getting national attention for their work, and it is critical to just about every other function we've got in this building because they are tied into just about everything else we do. So I just wanted to say thanks to Rob and his team, and we all ought to see some good news every once in a while right now. All right, on the remaining consent items.
Jimenez, Perales.
I don't know if we have a motion, do we?
Yeah, we do.
Okay.
Jones and Esparza.
Great, thanks. Thank you.
Okay, so Jimenez,
Yes.
Perales,
Yes.
Diep,
Aye.
Davis,
Yes.
Esparza? Yes. Arenas? Foley?
Yes.
Camus?
Yes.
Crosco?
Yes.
Vice Mayor Jones?
Aye.
Mayor Licardo?
Aye.
I'm going to go back to
Tony, I
Arenas.
think I missed mine. This is Arenas.
Yeah, I was just going back to you.
Yes.
Thank you.
Okay. All right, thanks, everybody. So now we're done with the consent calendar. Here we go. 10.1 is the land use items. I believe Councilmember Davis needs to recuse herself from one of those items.
Motion to approve? This is the consent?
It is.
You need to pull one out.
We
and
need to
vote
pull
on it.
one of them off, and I'm going to ask, let me see here. I believe Councilmember Davis has indicated it's 10.1A that she needs to recuse herself from.
Right.
Yes, I need to recuse myself from 10.1A.
Okay, and then I have, a member of the community would like to speak on 10.1, and I'm trying to figure
He's
out which.
left.
That's Gary Jansen.
Yeah, my staff is over in the council chambers and they informed me that he left.
He couldn't take anymore. I don't blame him. It's hard to sit through these many hours. So thank you, Gary, and I'm sorry we weren't able to hear from you. Okay,
So I'll make a motion for
10.1
10.1 B and C for approval of those first.
okay, so Councilmember Perales has taken 10.1 B and C. On this item, Councilmember Davis can vote. There's a second, Councilmember Esparza. Let's vote on these two items.
Jimenez? Yes. Peralez?
Yes.
Dieppe?
Aye.
Davis?
Aye.
Esparza?
Yes.
Arenas?
Yes.
Foley?
Aye.
Camus?
Yes.
Crosco?
Yes.
Vice Mayor Jones?
Aye.
Mayor Licardo?
Aye. Now we'll take on 10.1A. Is there a motion?
Motion to approve.
So move.
And Councilmember Davis is recusing herself on this item. Yeah.
Okay,
let's-
I have two motions and no seconds, so I hear Foley and Jimenez.
Second.
Was that Crosco?
Sounded like it.
Arenas.
Arenas.
Councilmember Arenas.
Okay. Okay, so is that Jimenez and Arenas?
I didn't.
Oh, it was Peralez then. You guys sound very similar.
I didn't actually.
No, it was me.
Oh
It was
my
Johnny.
gosh, sorry. This is why I'm repeating it, because it's hard to hear over here.
They're often
Okay,
confused.
so roll, Peralez.
look alike.
Jimenez.
Yes.
You all sound alike. Peralez.
Yes.
Hey, Johnny.
Dieppe.
Sorry.
Dieppe.
Aye.
Davis.
No, she's recusing herself.
Oh, that's right. Esparza. Yes. Thank you. Arenas.
Yes.
Foley.
Aye.
Camus.
Yes.
Crosco.
Aye.
Vice Mayor Jones.
Aye.
Mayor Licardo.
Aye.
Thank you.
Okay, cool, thanks. We're on to 3.7, which is ratification and declaration of Director of Emergency Services suspending commercial and industrial delivery and loading regulations. Really want to thank Dave Sykes and all the folks. I actually don't even know who was involved in this, but we moved really fast, and I just wanted to say thank you for moving so fast, because I know this was a real issue around restocking grocery stores and Costco and everything else. So thank you for that.
Mayor, can I also give some accolades to our city attorney who's been working on a lot of these declarations,
Yes.
Diana Ewan, who I think produced this in about a half hour or an hour, really a short period of time. So I just wanted to thank her as well.
Thank you for doing
and
that.
Really, really good work by the team. We actually turned this around in about 57 minutes.
Yeah, it's awesome.
Between the attorney's office and the city manager's office, once we made that initial connection.
I won't say this again, but occasionally states of emergency do get us moving. So it's a good thing. Okay. Any other comments? Questions? All right. Do we have a motion on this?
I'm sorry, I have one question.
Yes. This is council member. Which council?
Yeah, Davis.
Oh, Davis. Thank you.
The only question I had was, I didn't see it in here, and maybe I missed it. Did we put does this end when the emergency ends?
Yes, it does.
You heard that?
I'm sorry, I didn't hear that.
The answer is yes.
Yes, yes,
Okay.
it ends.
Thank you.
Are there any other questions, Councilmember Davis?
No, that's it. I just, I saw the recommendation, but it wasn't clear on when the ratification ends. So thank you, I appreciate it.
Great.
Councilmember, the resolution says the declaration shall remain in place until terminated by the Director of Emergency Services, the City Council, or upon termination or expiration of the proclamation of local emergency.
Okay,
Thank you.
great. And thanks again to the city attorney's team. We know this stuff is not simple. Okay, on this motion?
There were a couple voices.
Who wants to move?
I'll move approval.
Second.
Thank you, Councilmember.
Thank you.
Perez.
Okay, Jimenez,
Yes.
Peralez,
Yes.
Dieppe,
Aye.
Davis,
Yes.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Camus,
Yes.
Carrasco,
Yes.
Vice Mayor Jones,
Aye.
Mayor Liccardo.
Aye.
Thank you.
Thank you, everyone. Item 3.4 is something I accidentally passed over because it was originally scheduled to be dropped, and I asked to have it kept on for a couple items relating to memo that I drafted. Just for those of you who don't have that document, I know a lot of folks have been in and out of City Hall, may not have had access. This is the Spring Intergovernmental Relations Report, and I've just asked for that be heard for the purpose of a couple of items that prioritize advocacy with the governor in the state of California. And then paragraph A is around waiver of CEQA and state permitting rules and codes for emergency housing construction. And second, to mandate state chartered or authorized agencies to immediately identify and make sites of public land available for emergency housing construction. And then third relates to the allocation of homeless funding. That HAP formula, I know, is what the governor's office is going to use for this latest allocation of $100 million. And we want to ensure that it goes directly to cities, counties, and COCs rather than through regional administrators. So that is the advocacy we are seeking council authority for.
Motion to approve the mayor's memo.
I have a question.
Okay, thank you. And Councilmember Sparsa?
Yes, thank you, Mayor, for the memo. I had a comment and a couple of questions. So first, on the waiving the CEQA on item CA.
Yeah.
Does that mean, are you talking about the trailers, like the ones that are getting refurbished for the emergency respite, or I don't know what to call them? Is that what you're talking about?
It could take, and I know this would be, a very long conversation we'd have about what exactly would fit, wouldn't, but in my mind, it would include trailers, it would include tiny homes, may include modular construction that could be used for emergency housing or transitional housing. If we wanted to really take advantage of the opportunity to try to really thin out some of these encampments and thin out, we know the shelters have to be thinned out, as you know, by state order, and right now the options that we have in front of us are basically pushing people into city facilities, and then we're gonna have to push them right back out in the street. And I know that's gonna be necessary, but we ought to take advantage of this opportunity to build out some capacity, and that's what I'm hoping to do.
And so that's why we would advocate for waiving state building codes, because we're looking at sort of modular trailer type of construction.
Yeah,
Okay.
you may recall with Assemblymember Campos' legislation a few years ago, it essentially called for the waiver of a significant portion of the building code except for what was necessary for basic health and safety.
Yeah, and that's what the tiny homes is based on, so we're looking at expanding that, okay. And then I had another question on item CB. Did the governor already include that in his emergency order? Didn't he tell the state agencies to look at land already, or?
Sort of.
I wasn't
but
clear on that.
Not quite. And we're looking for something much more assertive and much more mandatory.
And this would be for the duration of the state of emergency, whether it lasts 30 days or 180 days? Okay.
Exactly.
And
it
then,
would go beyond state agencies. It would also include state chartered agencies like utility districts, for example.
okay. Okay. And then so that would be like, for example, water districts?
Yes.
Water district land, okay. And then on the last item, I just wanted to thank you for including that. I think we need that money. We don't need original administrators to take a bite out of that. So thank you for including that.
Thank you.
That's it.
Councilor Perales, did you want to speak on this item?
I did. So I supported. I was just more on how this might work, considering the item 2.22 that we just approved with last-minute blue memos might get kind of interesting. So just it really just a food for thought, just to think about it. I know that it's traditionally us as individual council members that might show up with a blue memo on the day of, and so I know that could get kind of interesting. So it's just maybe food for thought for the manager's office on how we might address.
You're talking about with regard to citing?
No, I'm
the
completely in
memo
favor. I'm sorry, didn't explain it well enough. I'm talking about in regards to item 2.22 with our meeting noticing and sort of the idea on 72 hours and for this sort of as we're bringing memos, if we go full digital and we're not coming in, we won't necessarily be able to bring blue memos in hand anymore. We're gonna have to. So that's all it was. It was
fair point.
Yeah, that's it.
So I was told this one was posted, but your point's a fair one, and that's why I wanted to sort of.
Yeah, I don't have any issue with this. I just thought of it as I was looking at it. So.
Well, what we can do when we're full virtual is when a memo comes in, we post it, we can distribute it out as well.
Great. Okay. Thank you, Tony. Any other comments? And I'm looking at my text now to see if any of my colleagues on the line. No. Okay. Was there a motion? It was.
Yes.
All right, let's vote. Thank you, Councilman Cameron. Let's vote.
Jimenez?
Yes.
Perales?
Yes.
Dieppe?
Yes.
Davis? Davis? Esparza? Yes. Arenas?
Yes.
Foley?
Aye.
Camus?
Yes.
Crosco?
Yes.
Vice Mayor Jones?
Aye.
Mayor Licardo?
Aye.
Before I go back to Davis, I did not get the motion in second.
Councilmember Camus?
Yes.
Was your motion? Yeah. And the second, I think, was from the vice mayor?
Second.
Yeah, I think so.
They're the farthest ones from me. It's hardest to hear. Thank you. And Davis.
Got one.
Davis, are you there to vote?
Yes.
Thank you.
Yes.
She voted twice, Chicago style. Okay. All right. Is the annual summary of labor negotiations still on? Is that 3 point? I'm seeing it on one list. I just want to make sure I'm not missing something.
What item was that, Mayor?
3.7. I'm sorry, no, that's a different item. Okay, there's just a typo here. Okay, I'll move on. Item
I think we're on 8.2,
3,
if I'm counting correctly.
okay. I think I have an old, let me just go by the computer then for a moment.
It's 8.2.
4.1 and 5.1 have been dropped. And so we are, as you said, Councilmember Perales, on 8.1 has been dropped, is that right?
I think we're on 8.2.
Yep, that's right.
8.2,
Yes. Yep.
that's right. Thank you very much.
That's all right.
Thank you.
Housing plan.
All right, so this is the annual progress report and implementation of San Jose General Plan Housing Element and Housing Successor, the Redevelopment Agency report. And welcome, Jackie and Rosalind.
Good Good afternoon, Mayor and Council. Rosalind Huey, Director of Planning, Building, and Code Enforcement. I'm joined by Housing Director Jackie Morales-Frand. The item before you is our annual report on the housing element. The housing element is one of 7 required elements in the city's general plan. The state has required that all local governments adequately plan to meet the housing needs of everyone in our community. California's local governments meet this requirement by adopting housing elements as part of their general plans. The city must approve an annual progress report on its status and progress in implementing its housing element. Each jurisdiction's annual report must be submitted to the Department of Housing and Community Development and the Governor's Office of Planning and Research by April 1st of each year. There are some new reporting requirements for calendar year 2018. They include listing the number of development applications received, planning entitlements issued, building permits issued, and certificates of occupancy issued. The annual progress report must also report on projects that applied for SB 35 streamlining, if these projects were approved, and potential affordable housing developments with filed applications. Also want to note that planning for the next RENA cycle is already underway, and staff will be coming to council later this year to share about that process, including the anticipated significant increase in our RENA number. The next RENA cycle will have to be completed by December of 2022. Jackie's now going to share about some details of our RENA numbers and goals.
Good afternoon. So the RENA goals are separated into 5 different categories. 60% of all our units are supposed to be affordable. The table before you shows the income category, provides you the range of income that it's affordable to for each category, the RENA goal, and the number of units that have been built. For example, our low-income units, which is 51 to 80%, the maximum income for households to qualify for the affordable housing apartment range from between $72,000 for one person to close to $104,000 for a 4-person household. The RENA goal is 5,248, and we have produced 617 apartments. I also want you to note that the median rent for Class A market rate apartments is getting very close to our mod income rents. And we think this is due to the softening of the rental market. Market rate rents require income to be 2.5 or 3 times the amount of the rent. So unlike the other ones, which are maximum rents, the item that you see there, close to $158,000, is what a minimum income is required in order to afford the medium rent in San Jose. During the first 6 years of the 8.8-year RENA projection period, approximately 68%, which is approximately 68% of the way through the current RENA cycle, the city has met 94% of its market rate housing goal, but only 18% of its affordable housing goal. The chart shows that San Jose is ahead of schedule in delivering market rate housing and is significantly behind schedule in delivering all income levels of affordable housing. The slower pace in building affordable units generally reflects the scarcity of local, state, and federal subsidies to fill the gap needed in order to build the affordable units. And also, the time and difficulty in assembling land and competitive affordable housing financing layers that are needed to build the many affordable homes required.
So this chart here shows that the city of the number of building permits that the city has issued in calendar year 2019, and that number is 2,425 units. This number is actually in line with the city's average of 2,500 building units that we issue each year since the general plan was approved back in 2011. I do want to note that ADUs made up about 17% of all building permits issued last year. Where, as you can see, we are meeting or exceeding our goals for moderate and market rate units, we are lagging behind in ELI, VLI, and LI. Overall, we are at about 61% of our total housing goal. So what has staff been working on in the last several months? Planning, Building, and Code Enforcement and Housing, as well as Office of Economic Development, continue to work very closely on several strategies to incent production, but also look to support affordable housing preservation and tenant protections. You can see here in the chart the items that we're working on. I'll just highlight a few of them. Under production, we have spent a lot of time these last several months focusing on our ADU program. The City Council has approved changes to our zoning ordinance that relax the rules for ADUs and keeps us in alignment with the new state laws. Staff has instituted ADU Tuesday at our permit counter, and at the direction of council, staff has designed an ADU amnesty program. Also directed by council, staff is working with the General Plan 4-Year Review Task Force on opportunity housing, where we're exploring allowing single-family parcels to be gently densified with duplexes, triplexes, and fourplexes. We think that this will help in producing more housing. As of the residentially zoned properties in the city, 94% of that land is zoned for single-family homes. Additionally, we've received conditional approval of SB 2 grant to advance our work on aligning the zoning with the general plan, which will also support the work of the next RENA cycle. You can see the items under protection. The council has approved the Housing Payment Equality Ordinance, as well as Ellis Act recontrol. And in terms of preservation, council has approved the mobile home park land use designation earlier this month and provided further direction to staff to apply this new land use designation to all mobile home parks. Also, staff will be bringing the anti-displacement strategy to council soon for consideration.
Soon is now a relative term given COVID-19, so that might be delayed as a result of our current work. The Housing Department is the housing successor to the Redevelopment Agency, and we report each year in the housing element our performance in meeting certain required state tests. The Housing Department has met all of the tests, and I did want to make note that while our cash balance is high, it doesn't take into account that we have committed through a NOFA $100 million of our redevelopment funds, but in order to count it to the state, we have to actually get that under contract. We don't actually create a contract with a developer until they get their tax credit financing, and most of them, well, we have 2 of them that are coming forward this spring. So with that, here are our staff recommendations for this item, and we are available for questions.
Thank you. Appreciate that you're both being pulled in a lot of directions right now, so thanks for taking the time to be here. Just a couple quick notes. First, I thought that the map that's attached, I think is attachment D, is really informative. Describe where development is happening in the city. Surprisingly, the ADU development is relatively spread out, relatively evenly. Not as much in the south part of the city as I would have expected, given the larger lots down there. I would have thought there'd be a lot more. Tends to be a little more focused in central, east, and west. But really appreciate all the hard work to really boost our ADU development. I know there's been a lot of changes in your department, Rosalind. I appreciate all the work you've done to align your team. And I know that a lot of that's going to get interrupted, obviously, with what we're dealing with today and the nature of the economy. But I think we were off to a really good start in producing more ADU units in 1 year than we had in the prior half decade. And that is really kind of transformative change we want to see, because we know it is so hard to get much else out of the ground, or at least it was for so long, because of high cost of construction and because of the lack of public source of dollars. I thought we ought to also at least mention or celebrate that Measure E did pass. So we hope when there are property transactions happening again in the city, and it will happen soon, I hope, but perhaps not immediately, but sometime, we're going to have a source of funding as well that will help to supplement Jackie's important work. I had a question about, actually, I lost the question, so that's okay. We'll go to Councilmember Camus.
Yeah, thank you both for your report. I know I talked to you, Rosalind, about this new effort to streamline the inspection process using video. Is there any way you can come back to us and let us know how that is working out? Because my estimate is I think that this can streamline it quite a bit and be a very valuable use. Instead of having employees drive a half an hour, they can actually do a lot more work with the same amount of time. And I was wondering if we can get some kind of report or info memo or something to that effect, because this is something we've been working on, well, probably long before I've even gotten here. But it's a real leap in the right direction.
Thank you, Councilmember Camus. Actually, as we find ourselves responding in this COVID-19 crisis, we actually have the opportunity to exercise and utilize the video conferencing tool. And actually, just last week, we've been training staff and doing some testing, and actually were able to conduct inspections by video. So it's currently happening now. Nothing like a crisis to kind of push us forward and actually embrace this new technology and really get staff up and running with it. So we'd be happy to share with you how that work is ongoing.
Yeah, no, I'd love that, and I'd love to see if you can quantify how many more inspections we're able to do because of this. You know, I think that would show a whole lot of progress. And in some way, I know that a lot of these inspections are booked out months in advance, just in case their work happens. I think maybe we can use this video conferencing tool potentially as a way to move people up in line as well, and further create some efficiencies as far as timing. So I really appreciate your work on this. This is I think something that shouldn't go away in the middle of the night. This should be celebrated because it's quite frankly, a leap forward for the department that we need to highlight. Thank you.
Councilmember Pross.
Thanks, Mayor. Just curious, maybe Jackie, your perspective on, do we think there can actually be a benefit on production of affordable housing because of COVID-19 and this crisis, or do we actually think that's going to hamper our ability to achieve some of these goals?
Well, at least in the short term, I'm hearing there is some hampering right now because construction workers are getting mixed messages regarding whether they can come onto the sites or not, or may have childcare issues, or just may be fearful. And so I know some of our developers have been challenged in moving forward. We continue to push out information to make sure that they understand what the governor's direction is regarding it being an essential service, but that doesn't address kind of the human reaction that some people are having. We've also been talking to them about whether there are longer-term concerns about supplies, because some of their supplies come from China, and when China shut down, there was concern about whether there would be available supplies that were going to coming back to the U.S. So, and then I think lastly, our financing world could be shaken by all of this. So the primary source of funding is tax credit and having tax credit investors. And
Jackie, I've just been told by one of my colleagues they can't hear you remotely. Could you
okay, so
perhaps
if
move
they,
it closer to you?
Yes.
Thank you.
If they, tax credit financing is the primary source of funding for affordable housing, and if they get, if the investors get nervous as they did before, then they are unlikely to invest. And we had that happen during the last financial crisis where the investment markets got very nervous about proceeding. So we could have long-term impacts.
any opportunities with Measure E dollars to take advantage of some of the what is happening, whether we're going to backfill this, these tax credits, or to keep things going, or to actually, maybe get into a market that maybe is a little bit more affordable to build, whether it's construction or other costs?
So in the short term, if there's any project that would be impacted by it, we could, and we did the last time, supplement that budget to keep it going so that the project wouldn't be stopped. So we're just going to have to wait to see how large the gaps become. I don't think we could I don't think the department could pay, because you're essentially building without a tax credit investment if there are no investors. So the gap would be huge. But if there are projects that are that are caught in the middle, so they've received a tax credit investment, but now the investor is not willing to put in the extra money that's needed, then we would definitely consider backfilling it so it could proceed.
Okay, thank you.
Councilmember Esparza?
Thank you. Yeah, I had a similar question, especially related to the NOFA that comes later this year. Could we use that to backfill or fill those gaps to get projects across the finish line?
Correct.
Okay, thank you. And then I think we covered a lot of information here, but given COVID, can we refer this to council or get an info memo moving forward? And I apologize if you already covered that, because
Oh, in terms of the
this coming back to us?
In terms of the potential impacts, yes, we could absolutely do an info memo as we begin to understand what the impacts to our developments are.
Okay, thank you. That's it.
Vice Mayor?
Thank you, Mayor. Jackie, as part of the housing strategy, I didn't see anything about purchasing existing buildings and converting them to affordable housing. And I just want to know where we are with that strategy.
So we had been talking to a person who was interested in purchasing for moderate income buildings that they would hold, and then the city would be able to acquire after a period of time. And we've put that on hold because of COVID-19, because we have to build more consensus and do more financial review, that this would be a model that the city of San Jose should support. But it's our intent to bring it back after the COVID-19 pandemic is done.
Okay, thank you. That was my question.
And then question I had related to, I know the low-income housing tax credit market is probably going to be upside down for a while as well, given all the financial fallout here. And I'm just wondering, given the commitments we've had so far with Google, Apple, Facebook, and others, is there a willingness from any of those entities to step into that role? I know they're probably not even thinking about this yet because everybody's still trying to brace for what's coming, but is there any opportunity for us to keep projects moving forward using their funding?
I think the challenge with their funding is it's short term.
Yeah.
And so what the tax credit program does is really provide that longer term commitment that they have been unwilling to invest in at this point in time, but it's certainly a conversation that we can have with them.
Yep. Okay. Well, when everyone gets their head up for air, I'm happy to have that conversation. Okay, just consulting again to see if any colleagues have texted. All right. We will move forward then. Is there a motion?
Move approval.
Thank you, Councilmember Peralez, second Councilmember Esparza. Tony?
Jimenez?
Yes.
Peralez?
Yes.
Dieppe?
Aye.
Davis?
Yes.
Esparza?
Yes.
Arenas?
Yes.
Foley?
Aye.
Camus?
Yes.
Crosco?
Yes.
Vice Mayor Jones?
Aye.
Mayor Liccardo?
Aye.
Thank you.
Thanks. Thanks, everybody, for the presentation. And I know we heard that because it has to get off to the state, so thank you for getting that done amid everything else you're doing right now. We're now on to, I believe, 8.4, which is amendment to the agreement with Destination Home Support Low-Income Households impacted by COVID-19. And Reagan is here. Hi, Reagan.
Hi, good evening. I'm Reagan Henninger with the Housing Department. And I'm here today with a recommendation to amend the current contract with Destination Home in order to support low-income households impacted by COVID-19. So the national and local emergencies related to COVID-19, coupled with shelter-in-place orders and school closures, have resulted in crippling effects on major industries such as travel, food and beverage, and small businesses. And many households are now without work and childcare. We know the results of these impacts are particularly impacting low-income households. And prior to COVID-19, so many low-income households in San Jose were already living paycheck to paycheck, where one single medical emergency could mean losing their house. Now, with COVID-19, we have even more devastating impacts on households without access to sick leave, quality health care, and/or those without work and childcare. So Destination Home is our existing contractor for our homeless prevention system that is already in place, and they have responded quickly to scale up the prevention program to try and meet this tremendous new need. So just a quick reminder about our current homeless prevention system. The program provides countywide access at over 14 locations and a central phone line. The financial assistance is immediate, typically within 72 hours or less, and the program also supports households with case management and other resource recommendations. The program before COVID-19 was tremendously successful, with 95% of people remaining stably housed and the average financial assistance being around $4,100. A lot of this program infrastructure will stay in place for the COVID-19 emergency response. So Destination Home, working with Sacred Heart, who is our lead coordinator for the prevention network, will use this infrastructure and network to respond. Working with those partners, there'll be two primary tracks for emergency assistance. The first track and the primary track is financial assistance with a focus on replacing lost income and keeping people housed. Then there's a secondary track that will include not only the financial assistance, but also any needed additional support, such as case management or legal support. And as always, the guiding philosophy of this emergency response program remains the same, and that is to quickly respond to need, provide easy access via online, phone, and multiple locations, and provide as much flexibility as possible to meet the unique needs of each household. And with that, this is our recommendation to council, available for any questions.
Okay, there's a recommendation, and want to express gratitude to a lot of public and private sector leaders who have been working together to grow this fund, and we're still at it. I think we had a good start, as we announced yesterday, with nearly $12 million committed, and appreciate everyone's hard work on it. We'll keep pushing. Councilmember Esparza?
Exactly. It was a really great example of everyone coming together, knowing that we have a lot of already vulnerable people in our community. As I noted earlier, Sacred Heart had 1,200 people, families apply yesterday alone. I guess this is a question for the city manager in terms of, are there other forms of support that we can provide this fund? So I'm looking maybe at how Reagan or Dave in terms of what we can do moving forward, because they were just inundated in one afternoon.
We're up to 1,600 applications as of this morning. And we are working with Destination Home, looking to some potential federal sources to help as well. We can look at additional housing sources, but we
Great.
brought forward what we had available today.
Yeah, no, I mean, certainly, I'll move to approve this recommendation. I'm thrilled to do it. And just so you know, I had a conversation with Congresswoman Zola Lofgren's office today saying, hey, because they said, hey, the website isn't working. And my response was because it crashed, because so many people have been going online. The need is so great, and we really need the federal government to step up. And that's sort of the battle that's happening right now in Congress. So thank you for everything. This was a huge effort, and we knew it was going to be big, but holy moly, I mean, it's a lot, and it's going to grow. So yeah, thank you for your hard work. I know a lot went into this. So thank you. I'll make the motion to approve the recommendation.
Thank you. Councilor Jimenez?
Thank you. I just have a question, or a few questions. The first one, it may be a silly one, but the homeless prevention system, I think the map you showed, obviously that's countywide. But these dollars are for San Jose residents, not necessarily countywide, is it?
That's right, but I will just put a fine point. Overall, countywide, the system serves about 70% of who is served are San Jose residents. So we contribute a minimal amount of dollars, but we see a huge impact and a huge benefit and a leverage to our money.
Okay, so if I'm from Sunnyvale, I go to Sacred Heart, do I get turned away? Because I guess I'm trying to
No,
understand
you don't
your
get
question.
turned
I don't
away.
get turned
You
away.
can go to any of those access
Okay.
points. You can go online. You can call the central hotline. You don't get turned away.
Okay, and then so the trying to understand exactly what you said, so or make sense of it. So for example, city of Sunnyvale, Mountain View, other cities within the county, they all contribute to the system. Homeless prevention system countywide? Or?
There's a county-wide contribution, a contribution from the county. My apologies.
From the county. Okay.
From the county that is more than what the city contributes. I don't recall the number off the top of my head, but
All right.
They just added another 2 million, I think, today.
yes, they did.
Okay. Cool. Okay. Very good. Is there any way to know how many of those folks? Do we actively? I imagine we actively keep track or can pull numbers as to how many of the folks that seek assistance and get it are from San Jose.
Yes, we track that.
And do we know more or less? I mean,
About 70%
that was
of
that
the
number. Okay.
people that are served program-wide throughout the county are San Jose residents. Does that make sense?
So it does. So I assume you're taking that 70% and applying it to the number of folks that are getting this money and saying that 70% of the recipients of that seek the 1,600 applicants, 70% of them theoretically may be from San Jose. Right? Is that essentially what we're?
Let me try again. All of our funding pays for San Jose residents. But the San Jose funding, we're not the sole funder of this program. And so we contribute about a quarter of the costs. However, our residents receive about 70% of the program.
Okay, all right, that makes sense. The other question I had is, I know this money's coming out of the, and again, I second it, I support it. I just wanted to get a better understanding. The City Housing Authority Reserve Account, when is that used, if any, if at any time? Like, can you share with me like a circumstance in which we would need that? And because I imagine, I don't know what the current balance is, but when would we need that, if any, at any time?
So this is a source of funding that we received as a result of a litigation settlement, and there's a requirement that the funds have to be used for low-income households. We had earmarked some of this money to be spent on some production things, but now with Measure E passed, we were able to redirect some of the funding to this COVID crisis.
Okay, all right, I appreciate that, thank you. The other question I had is, and I I didn't know 1,600 people or so applied, which is amazing. Unfortunate yet amazing that folks are reaching out. And so, should I assume that Sacred Heart is that main sort of entry point, or are there other agencies? Because I think there were
Sacred Heart is the overall coordinator.
Okay.
But there are over 14 different entry points across our county.
Okay,
There's
okay.
one central hotline, there's one central website and online application.
Okay, I appreciate that, because I clicked on the link that was presented as it relates to Sacred Heart, I think on some press releases, and I went there and I didn't necessarily see an application, and then I went to the, it's in English, but I know you can change the language, and I went into the facts, COVID-19 facts, and it's all in English, and I just didn't know if we can just relay that to our partners to the extent it's even necessary, given that a lot of people are applying, but I suspect there's a lot of unmet need out there that.
Yeah, I've seen everything in English and Spanish,
Yeah.
but I'll double check and make sure
Yeah, so if you
that
go on
that
on that
website's-
link where it says, it talks about the process, the money that's available, you go to the COVID-19 facts, and then you go there, it's only in English, even if you change the language, but check it out. I just,
Thanks.
and the point of that is just simply that obviously we have a very diverse community, and I was poking around just to get a better sense as to, make sure we're really attentive to the needs of the variety of folks in the
Yeah.
county. But thank you, I appreciate it.
Great. Other questions? Going to the text for colleagues. I don't see any colleagues who have texted.
Mayor, I
Yeah.
do have a question.
Councilmember Arenas? Is that right?
Great, thank you. So Reagan, this amendment reflects the conversation that we've been having for the last 2 weeks, correct?
I think so. Sorry, I don't recall conversations with you, council member, but I have been in the EOC for 12 hours a day.
At council, I've been having these conversations with Sacred Heart and Destination Home in terms of how to support our families. And so this appropriation is the result of those, or is an action to support those conversations, is what I'm trying to figure out.
Yeah, that's right.
Okay, so I'm really happy to see in this memo that you've reflected on the results of the COVID-19 and people losing their income and having not only just not stable housing, but also lack of childcare. And I think those two things go together as well as work. Will you include some workforce development as part of, or do any of these programs include workforce development? I foresee that some industries are not going to be as utilized as others, or, the restaurant business is probably not going to be booming. And so then folks who might be waitresses or hostess might have to steer in a different direction. Is there a workforce development element to this?
Hi, council member. There are 2 tracks. One track is just financial assistance, and that's typically for folks who have a pretty stable household and don't need any other kind of supportive assistance or case management. We do have a second track that will offer case management, supportive services, kind of workforce development assistance, and those kinds of connections if needed.
Great, thank you. And I just want to make sure that as we're helping stabilize families, that we're also taking a look at a bit to the future as we see some of these service workers or hospitality workers, how we are going to support their workforce development as we see some of these industries probably not thriving as much as before this virus exploded in our society. So thank you.
Thank you. Any other comments? Just want to give a quick shout out. Well, thank you, Reagan, by the way, for taking time, despite the fact that you have not probably seen the light of day outside the EOC. So thanks for all your push, and want to thank everybody who's been partnering with us on this effort, really led by Jennifer Loving over at Destination Home and her team, and Chuck Robbins at Cisco, and Cisco contributed, I think, $2 million. Mike Cordano at Western Digital, they kicked in $1.5 million. Shantanu Narayan at Adobe was in for $1 million. Hawk Tan and Broadcom for $500,000, as was Eric over at Zoom, as well as Sanjay Maroda at Micron. And I know we also had strong contributions, I believe, from HPE and Greg Mellinson over there, and many other folks. I believe Google and Facebook both contributed in the six-figure level. So anyway, a lot of folks, and we're going to keep asking more folks for help because we know we're going to need it. Okay, any other comments? All right, let's vote.
Jimenez,
Yes.
Peralez, Diep,
Aye.
Davis,
Yes.
Esparza,
Yes.
Arenas,
Yes.
Foley,
Aye.
Kemmis,
Yes.
Crosco,
Yes.
Vice Mayor Jones,
Aye.
Mayor Liccardo.
All right,
Thank you.
okay. Thank you very much, Reagan. Hope you get some sleep. Okay, I think then we're off to public comment. Is that correct?
Yes.
Okay, we have several members of the community who'd like to speak. Jeffrey, whose last name I can't quite read, but he says he represents the CWNIA. You have the first card. Followed by Mark Trout, Robert Aguirre, and Scott Largent. So I don't know how many of those gentlemen.
If I'm not mistaken, it's just Scott and Robert that are still left.
Okay.
But we'll see.
Then if Scott and Robert are there, or anyone else who I've read, please come on up to the mic. Thanks. Welcome. I know the communication system may not be working well for everyone, so I just want to check in. If any of those gentlemen heard their names called, please come forward to the mic. We'll take any one of you first. Scott Largent, Robert Aguirre, Mark Trout, or Jeffrey from CWNIA. Okay. Is there a way for us to verify whether or not people are still there?
Yeah.
Okay, thank you.
My staff says the guy can't be heard
Okay.
and that he's speaking.
Okay, so the audio is not working. He's trying to speak, and we're not able to hear him.
Come in here since there's room now? Yeah, it's just two people, right?
Yeah, could we, given the small number, could we allow them to come in one at a time?
Yeah, I'm telling her to bring them over here, and then
Okay.
we'll get a microphone out.
And I know we'll have more conversation offline about how we can work out all the kinks, but I'm just wondering if it's time for us just to move to a.
I think if we go full virtual, we'll have a lot less issues.
Yeah,
It's the
I
hybrid.
appreciate the point, and I think maybe even just being able to have people give us their phone number and we'll call them. Something along those lines might make it easier, old-fashioned telephone.
Can you guys hear me in there now?
Yep. Yeah, we can hear you.
Can you hear me now?
Yep, we can.
They can hear you. Yeah, go for it.
All right, I'm going to have them use this microphone in here. All right.
Yep.
Wait till I get seated here.
Okay. Robert Aguirre here. I'd like to talk about, first of all, the 14 sites that have been set up for hand washing stations for people living in the streets. I don't think that's enough. I think we need to look at that a little closer. Also want to talk about the lack of food for people that are not getting fed because the different church groups and so forth are not coming out like they used to because they're afraid of getting infected. We also don't have a way to inform the houseless people. A lot of them don't have a way to charge their phones because the library's closed and most of the other city facilities have been closed, so they don't have a place to go. So that creates a real problem. We need to get that out. I don't have a timer, so I can't see how much time I have left. We need IR thermometers for the different sites that people are going to and getting sheltered because we need to be able to tell which people may or may not be infected. And one good way to do that is to take their temperature as they come in so we can figure out who the people that have elevated temperatures that we can send to a medical facility so they can get tested. And so we need to do more to keep people safe. There's a lot of people that are running around on the light rail and on the buses, and it's just creating an incubation chamber for people to be able to transfer whatever they may or may not have, become susceptible as a result of that. And I think that we also need to have more people going out into the encampments, and if we could somehow get the people that are currently working as advocates to be empowered with the ability to go with information into the encampments that we already visit anyway, and provide them with postcards or something that explains how to deal with this situation. Thank you.
Thank you, Robert. There's now a lot of feedback on the mic, and I'm hoping we can fix that for our next speaker.
Okay, do we just hit the clock, or?
We can hear you, Scott.
Okay, we're going, okay. Good afternoon, everybody. Scott Largent. Spent most of the morning and afternoon over at the supervisor chambers, kind of trying to light a fire underneath the county to start bringing in trailers or do something in the actual parking lot across from the county building. I'm currently homeless at the moment. I was couch surfing, kind of bouncing back and forth, and now I'm basically stuck in the struggle of downtown here. People really have no place to go. I'm not trying to embarrass the city of San Jose, but I did put together a video of your overnight warming location that's at the Roosevelt Community Center, and that is the most disgusting thing I have ever seen right now. They are not socially distancing people. They've dropped it by 1/3 the capacity. You have a rec center right now that is closed that would be great to utilize as a shelter right now. You can socially distance people. I would recommend getting on the horn with Grace Baptist Church. They're doing it properly right now with minimal money. Something just needs to be done right now. If you walk out that door right now, all that is out there are the severely mentally ill, the homeless, and the meth addicts. The meth addicts on the streets right now, you have to figure out some way to put them on mental health holds and pull them off the street. They are defecating, they're wiping themselves, they're touching everything, they are not using any type of sanitary equipment at all. This is just going to get bad, and the light rail right now is like an incubator. 4:30 in the morning, homeless people and meth addicts are hopping on that and using it to stay warm, to stay dry, and it is the most disgusting thing in the world, and I would hope that you people are paying attention right now. Please watch the videos I put up on YouTube. It is not meant to embarrass San Jose. It's meant to fix this problem. Thank you.
Thank you, Scott.
Thank you.
That was everybody.
Okay, those are all the members, the public, okay. Okay, back to council then. The meeting is adjourned.